Chuck, Chuck, are you ready? Deb? Good evening, everyone. I'd like to call the July 22nd, 2021 Peninsula School District Board of Directors meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Before we start, I just wanted to call out, many of us are aware that we began our summer on a pretty tragic note. We lost one of our students in late June, Caleb Wanaka. He was a good friend to many of our kids and played ball with some of our kids. He was well liked and well known in our community. Myself and some of the board members and Superintendent Barr attended a very wonderful, inspirational, and emotional ceremony at Peninsula High School field. Over 800 people attended Caleb's ceremony, Wani, as we like to call him. So I just wanted to say that I know there's some people in the audience, I won't call you out by name, but that helped organize that wonderful event. So I think I speak on behalf of the entire community. Job well done for that. We'll always remember Wani. Okay, next is approval of the agenda. Are there any changes to the agenda? Hearing none, is there a motion to approve the agenda? It's been moved by Deb, seconded by Lori. All those in favor? Aye. Opposed? Motion's carried. Consent agenda. Is there any discussion before the consent agenda vote? Hearing none, is there a motion to approve the consent agenda? No motion. It's been moved by Chuck, second. Seconded by Deb. All those in favor say aye. 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 Opposed? It's been moved or carried. Okay, next up is item number 5. Peninsula School District is a member of the Washington Schools Risk Management Pool. The board has asked the pool for guidance regarding masks in schools. Attorney Charles Leitch is here to provide that for us. After the board has their questions answered, we will address any unanswered relevant questions submitted as time allows. So I know that some of you have cards, so when he's done, we'll ask questions as we see fit. And then during that, if you write your questions down, we'll get those to you and they'll be up to the board and we'll ask those questions if you have them. Okay, so Charles?
Sure. Is this on? Oh, there we go.
It is now.
All right, everybody hear me okay? So this is a matter of kind of preliminary fashion. You mentioned it. Peninsula is part of the Washington Schools Risk Management Pool, and school districts in the state of Washington, there's basically two essentially larger pools that handle the risk management and i.e. kind of insurance type things for school districts. And the Washington Schools Risk Management Pool is one of the two. My relationship with them is I'm an attorney in private practice who goes ahead and actually advises school districts through the Washington Schools Risk Management Pool that essentially puts me on panel, and then I'm retained by the pool to represent school districts. I also have a general practice that advises school districts, and unfortunately as of March of last year, I became one of the attorneys who was charged with advising school districts kind of through the pandemic. So I'm here at the request of the superintendent and the board chair to offer you kind of, I guess, a state of affairs, if you will, and also hopefully maybe shed some light on kind of how we find ourselves here and maybe where we're going. And I think more importantly, to go ahead and shed some light on what is within your control and what realistically as a school district is not within your control. So first and foremost, currently with regard to the issue of masks, and everyone's been asking and talking to a large degree about what is happening with masks for the purposes of the 2021-2022 school year. At this point, as far as we are concerned, there is a high likelihood that masks will be mandated for some populations in school. Now, I'll give my lawyer answer when you say, okay, what does that mean, Charles? Who is subject to that? It depends. That's my favorite lawyer answer. So I will tell you that for the purposes of that. And when I say that, I don't speak as any sort of authority who makes that decision. I want to be very clear, and I've also told the superintendent this. I'm not the state government. I'm not the Office of the Superintendent of Public Instruction. I'm not an employee of Peninsula School District. I'm not a doctor, and I'm not part of the Department of Health on the county or the state level. What I can tell you is that the obligations that created the mask mandate in the state of Washington were not caused by any single or collective group of school districts or school personnel. Just like all of us were subjected to the pandemic when it came out, and subject to the authority that was basically delivered down by the state government. And regardless of how you feel about the state government or the governor, they have the authority, he has the authority under the emergency powers statute to go ahead and do what he has been doing. The school district, just like everyone here, private citizens, is subject to that authority. The other agency essentially that controls kind of our destiny, if you will, when it comes to regulatory action on masks in the state of Washington is the State Department of Health, the Secretary of Health, which is the health agency which is charged with a variety of enforcement functions and administrative functions in the state of Washington. Obviously, their paramount concern is what's going on with COVID at the present time. And then you also have the county or local health departments, as we call them. I'm sorry, I feel kind of like I'm rotating. I want to listen. Hey, look at that. Cool. All right, there. That's probably easier for you guys. Sorry, looking at my butt. It's not that pretty. Okay. So bottom line is that the Department of Health on the state level as well as the county level has enormous power. It very rarely is exercised. One of the powers they do have is they can go ahead and they can shut down a school if there is noncompliance with directives from the state or the healthcare authority. Now, and I've been asked this question, I've talked about it umpteen times. People have probably heard, if they've gone and talked to the healthcare authorities or to the Department of Health on the state level or the county level, and said, well, I don't want masks for my kids in school. I don't want staff to have to wear masks. I don't want to have to wear a mask. I want to be able to go to football games. I want to have what we had before COVID came. And you have that kind of question posed to them. What they have generally been doing, and this is something that happens not just in Washington, is they will say, well, it's local control, right? Some of you probably heard that. It's a local decision. I am here to tell you, as a lawyer for 135 school districts who's been working on this issue, I'm a former prosecutor in King County and a prosecutor in Oregon, and I'm a law and order guy, rule of law guy. It is not within the school district or the school board or the superintendent's authority to get rid of the mask mandate. If any school district, which in the state of Washington, not one school district has kicked the mask mandate out. Okay, let's just keep it in mind. Not one group has sued in the state of Washington successfully to get rid of the mask mandate in school. And I know a lot of people, I got people in my own family that we get in these debates about it. Everyone is very passionate about how this has impacted their lives and is impacting their children. And everyone can make their own individual choices in many respects. But school districts are run using federal, state, and local money. In fact, you would be surprised to realize that the vast majority of the funds that go to this district, and most districts, or every district, are state money and federal money. And when you take that money, it comes with strings. And the strings are the state, if you decided, or any district decided, and I would advise against it because my job is to have the districts go ahead and operate as successfully as they can, to say, we're going to pitch out and get rid of a mask mandate or something of that nature, you would risk regulatory authority being brought to bear both on the Department of Health, the governor, as well as conceivably something through a funding enforcement action. Now, You know, the governor has the authority to go ahead and issue these orders. There's criminal penalties. We've heard about that. I don't think you're going to have people, you know, no one's going to arrest the superintendent or the board chair, as much as that might be exciting. It'd make my weekends probably get crazy. But realistically, what is going on with the enforcement actions is that we are beholden to those directives. The mask mandate is currently in effect. I don't know what next year is going to look like. I don't know what will happen as I get the guidance, I interpret it, I talk to the people, and I go ahead and I give advice, and then the district does what the district does, and this is what I do. And I spend most of my practice these days reviewing things, writing letters, and on the phone talking to agencies and trying to figure out what's going on. I don't know what is going to happen with the mask mandate. What I can tell you is that we've all been hearing what's going on nationally with the Delta variant, right? We know that the Delta variant is increasing. We do know right now, regardless of what you believe, that vaccinations have become a higher and greater priority today than they were last week or the week before or before that. That is because 97 to 98% or 96.5% of the people that are currently hospitalized and getting intubated are unvaccinated people because of the Delta variant. That's what's going on. Now, the situation that's going on with the Delta variant also is there are other people with risk factors, granted, but the priority for the government on the state level here, the information that I have, is on vaccination rates. If vaccination rates don't go up, and if Delta rears its ugly head and results in hospitalizations and intubations, not cases, testing is becoming less important because of the fact that we know that it is much more oriented in its transmission towards unvaccinated, that if those numbers are of concern, that will impact mask mandates. Unfortunately, it'll impact mask mandates not just in schools, it'll impact mask mandates across the board. Now, the district in its decision making has to look at guidance from OSPI, which is currently being updated for next year. It has to look at guidance from the Secretary of Health, which is currently being updated for the next school year. It has to look at how we go about dealing with vaccinated individuals versus unvaccinated individuals, which is currently being updated and developed. So literally, I can come back next week and we can have a whole different discussion on what's going to happen. The one thing right now, the analogy I used earlier talking to the superintendent is you're a boat on the ocean. You don't control the weather and you don't even necessarily know what the forecast is. But you're on the ocean and there's nowhere you're going to go in the middle of this, and we've just got to get through it. And so in terms of kind of where we are on COVID, the good news is we're going to have 5 days of school in person. The mandates are for that. And honestly, the prioritization is going to be to get kids in school 5 days a week and to have the most normal academic experience. Because under the Constitution for the state of Washington, every student's entitled to basic education. Basic education is not, I hate to say it, band, sports, hanging out with your friends, being able to go ahead and go on field trips. Basic education is reading, writing, math, and curricular requirements to go ahead and get kids on so they can get a diploma and be productive members of society and better themselves. And that is going to be the core priority. And anything that takes away from that is going to be an issue. The other aspect that is kind of a dynamic piece is that the school district is an employer. And just as I've been dealing with mask mandates and supervision of students and virtual learning and everything else, I've also been dealing with just the complications and issues related to being an employer for the last year and a half. That means working conditions, which is part of collective bargaining, which they have the right to talk with the district about. That is a matter of L&I. That is a matter of the Department of Occupational Health and their directives. And that is all guidance also that is being updated right now. So we're in the middle of kind of this regulatory blizzard, if you will, and it's been very, very difficult for school districts across the state to go ahead and deal with this. To make it even more complicated in this kind of environment is that we're in the state of Washington, which is, whether you like it or not, I'm sure you're all aware of it, one of the more liberal states in the United States of America. Because of the fact this is one of the more liberal states, unlike a lot of other states that have gone ahead and kicked out the mask mandate or gotten rid of some of the regulation of how they're doing school, the state of Washington has no caps on liability for school districts at all. Like Oregon has caps. You can only sue a school district for $800,000, nothing more. They kill a kid because of COVID or anything else or an accident, that's the max, okay? State of Washington, no cap. Colorado, you want to sue a school district, the Columbine, horrible tragedy. I unfortunately advise on these type of events. They have sovereign immunity. Columbine, one of the worst events in basically the history of the United States in many respects, a watershed event, unfortunately, for school safety. We're talking about safety here and safety with COVID. They never sued the school, okay? I represented the Tacoma School District on the Foss shooting case. I represented the Marysville School District on the Marysville-Pilchuck shooting case. I've been on 3 districts and schools on site when shootings have happened. In the state of Washington, on top of all that trauma, we have to deal with the fact that we have exposure that relates to that. These other states don't have that. So when we make decisions, whether we like it or not, I have to go ahead and go, okay, these are the risks you run about going through and looking at it. You know, one of the things that we look at is what is the state of the guidance? What are the state of the experts and what do they tell us? And as much as our school nurses are phenomenal and have been doing phenomenal work during this pandemic, they aren't infectious disease specialists working at, you know, the Center for Disease Control or even the American, you know, Academy of Pediatrics, which quite, you know, I guess sensationally, just earlier issued a bunch of guidance saying they think everybody should be masked in schools no matter what. Now, that's not the guidance in the state of Washington currently. And that's not going to be necessarily the guidance that schools have to follow. But whenever somebody in that environment says that, that's something we have to interpret and we have to look at. That's what I look at, and I advise on it. And it's a moving target. And it's one of those things that, quite frankly, one of my ires has been that a lot of school boards have been put on the firing line, for lack of better characterization, on things that they don't necessarily have control over. And why do they say local control? They say local control because they don't want you to be mad at them. That's my theory at this point, because they're so tired. People are on the front lines working the pandemic. They can't necessarily handle the fact that we are all very emotional about this. We're very escalated. So in terms of kind of the mandates and where we are, I am very hopeful that by the school year's commencement we'll be in a better place. If you want to do something, and this is my plug, and this is me and not the Peninsula School District or anybody else, regardless of your politics, if you get vaccinated, that helps because the statistics and percentages on vaccination help inform what the state government and what the Secretary of Health and what the health departments are going to be doing. And right now, because of the Delta variant, it is making a difference. And whether you like it or not, my brother is probably one of them. I mean, he doesn't believe in government, quite frankly. He's I love him dearly, but he and I see very end of the spectrum. He just got vaccinated because some of his favorite conservatives just came out, even though they hate mask mandates and they don't like the federal government and everything else, they just came out and publicly said, at least get vaccinated because the vaccine works. So, you know, at this particular juncture where we're at, we're still in the middle of this, and we will see kind of where we end up. I think as much as, you know, if you do want to be frustrated with me, agencies, and things of that nature. You can even be frustrated with your new superintendent, who's a great superintendent as far as I'm concerned. But what I can tell you is that don't be frustrated with the teachers, and don't be frustrated with the principals, and don't be frustrated with the nurses and those people that are boots on the ground. Because quite frankly, they're just doing what people like me are advising them after looking at the guidance. So, and I wish I wasn't here, and I wish we didn't have to have this discussion. But unfortunately, we continue to be facing this. So, and I guess I'll take any questions, or is there something I haven't hit for the board if you want me to go ahead and round out to?
Thanks, Charles, for coming tonight.
Sure.
I'll ask the first one. What I thought we could just do is, if anyone has a question, we just take turns, ask one, and until we've exhausted the questions. Does that work? Okay. So some legislatures in the state are saying that, pushing back on school board members when they say that it's not a state law and they're saying that school boards can vote to eliminate the mask mandate, where my understanding is that under his Emergency Powers Act, the governor, whether we like it or not, has the ability to make a proclamation, and that is the same as a law. Is that correct?
Correct. For temporary, I mean, the issue is what the extent of his emergency powers. As long as there is a pandemic that currently is effect, it is within his powers. He also can direct the Secretary of Health, which is another administrative authority. So under the Emergency Powers Act, it does have the effect of law. That's where the criminal penalties even are talked about, which I think is less of an issue. The issue with school districts is, honestly, if a district goes ahead and says we aren't going to do this, they're going to descend on that district pretty dang fast, because they can't have things get out of hand for the purposes of the next school year in terms of kind of that mask mandate. There's a lot of things that would flow from that.
But, okay, and just to piggyback off that, the Secretary of Health for the state works for the governor as well. And so he would basically implement the governor's mandate or proclamation. So if we would also be violating the health order by the Secretary of Health, right?
Correct.
Is that legal binding? If we
Correct.
did that, would we also be violating that order as well?
They have an independent authority, also down to the local health districts, where they literally, if they believe there's something that's impacting health and safety in a district, they can physically bring an order and shut you down. There was a school district that actually had a incident where literally we had a bunch of kids who were in a sports league outside of the school, but were playing, and they had a massive test. We had like 30 kids all test positive, and they were going to go ahead and this is one of the things that came up for the testing of athletes at the end of last year, is they basically wanted them to test everybody, and they basically said, well, we don't really want to, because people didn't want to be tested. And the Department of Health came in and said, it was the local Department of Health, and basically said, if you don't do this, we're going to shut down the physical operations of school. So they have the authority. It's like a snow day. You know, it's kind of the same thing. Just as the superintendent can call a snow day because of snow, the Department of Health can come in and exercise that authority. Now, it hasn't happened before because we haven't had the pandemic before. It's more along the lines of, you have a pool and you don't have lifeguards, or you have a building that has asbestos, or you have something that's it's bad building, sick building type environments, or even an outbreak of some of these other kind of infectious diseases that have occurred, but to much smaller amounts.
Yeah,
So.
thank you, Deb.
So Charles, if a single board member or a board collectively, or a superintendent, or a district as a whole, does not have the authority to get rid of masks in our district without major ramifications, loss of funding, shutting down, and somebody continues to have that complaint, who is the best person or body, government body, that they should go talk to, that has the authority to make this
Sure.
different? Because it's not us.
No, Department of Health.
Department of Health
Department of
locally?
Health. Local, but also, depending on what they say locally, the state level, the state secretary, but those two people, those are the people, like even the governor's proclamation, and they're acting consistently, but that's one of those things where, and these are the people that are saying local control oftentimes, but if one of the things that literally, I've had so many discussions about districts wanting to do stuff, and I'll be like, what does your local health officer say? What does the MD, who's the person who's charged and has that authority, and what is the secretary saying? That's really where it is, where the science is for lack of a better characterization.
Okay.
Yeah, but that's the situation. In fact, there's an argument to say that if you went ahead, you all took oaths to the Constitution of the state and everything else as a director, that if you passed something that said there's not a mask mandate, that would create a little bit of a constitutional crisis between you and the superintendent, because the superintendent has the same oath, and it would be a situation where I don't know if the superintendent would necessarily have to follow that, believe it or not. I mean, it's one of those things. Now, I'm be clear here, I haven't done the legal briefing on that in complete yet, so nobody quote me on that, but I'm saying that those are the types of things where if we got to that point, we might have an issue. Now, it's very telling, we've never gotten to that issue in all the districts that I've dealt with. There's a lot of information out there on the internet and in the ether, but hasn't happened officially for a school board yet.
Thank you.
Hope it never does, but.
Is it, can I just ask a follow-up on that?
Sure.
But if the board, a school board, not necessarily this one, if they eliminated the mask mandate in defiance of the state order or the state proclamation, and basically directing the superintendent of that school district to go forward and let kids and teachers back to school. Is that superintendent then in violation of that same law?
Yeah, sure.
Okay,
I would be, as a school lawyer, I could tell you hypothetically that if I had a school board do that and direct the superintendent to do that, I would be under my obligation as a school attorney for a couple decades and under this stuff to tell the superintendent to disregard what the board did and to talk to the secretary of the Department of Health and everything else. Because you can't, I mean, as much as we all like to, you can't create an environment, like a mask-free zone on district property in the middle of the state of Washington or in the middle of Pierce County. It's not within your authority to do that. So it's one of those things that I would say it's something that it would certainly be complicated. I know, superintendents are put in a position where they have, 5 bosses, if you will, that have varying opinions about stuff. But I think that in that situation, you'd have issues not only from the board side, but if you did that, you'd have issues on the employment side. And especially with, that goes back to the vaccination numbers and the Delta variant, is that when numbers went up or go up, people are worried greater. When numbers were going down, which is what happened actually to make a lot of us come back to the hybrid models where we had kids back for part-time, was that the numbers were going down. Now, we don't look at the numbers as much with Delta, we look at hospitalizations, because honestly, if you're vaccinated and you get, not Johnson & Johnson, but so I hate to be discriminatory against the JJ people here, but if you have Moderna or if you have, Pfizer, realistically, you can be exposed and even have a breakthrough infection, but you aren't going to suffer the consequences. Your body is more equipped to deal with it. And in that situation, that's what's going to dictate really where you go. We're kind of along for the ride, for lack of a better characterization.
yeah, thank you. I just wanted to point out for anyone in the back that's by yourself, there is an empty seat in the front. Chuck, do you have a question?
No. No, I think it's been asked.
Okay, got it. Thank you for coming.
Sure.
So we are expected to receive updated guidance throughout the summer and probably well into the fall. So as things change, we've heard one of the options that the governor could offer is to move this from a state mandate to a locally controlled mandate. So if that's the case and it goes to Pierce County Health Department and they impose a mask mandate, what then are our options, or is it the same as a state mandate?
Same thing. Like literally, I mean, and if they did the opposite, first of all, I wouldn't put money down on the state mandate going away because I think everybody does, I just wouldn't at this point. But if hypothetically the governor rescinds the emergency order and takes the mask mandate out, has the Secretary of Health say, I'm going to defer to local control, and you go to Pierce County, and Pierce County says, the doctors say, no masks, we're done, then we're done. But if they say masks, it's within their authority, then it's a matter of if they go ahead and say that, you're beholden to it. And if they say that and expect you to abide, and if you don't enforce it, then you're creating exposure for yourself to employees. There's a bar for liability we have for L&I, labor and industries, right? That's why we have L&I in the state of Washington. But if you go ahead and act as an employer with deliberate intent to go ahead and disregard what is essentially the safety and health of your employees, which would be possibly a situation if the Department of Health is saying that, where those people could sue the district direct, even despite workers' comp. The employees could say, if somebody gets it, takes it home and spreads it. Now, proven that's hard, but there is kind of a presumption now with some of the legislation that if you're exposed to COVID while you're working in a school district, that you got it while working at the school district, and therefore it's covered under the model of the law.
Thank you for coming.
Sure.
And especially appreciate clearing up the differences you see from state to state. Why it looks different in Texas maybe than it does
very,
here.
very. And I have friends in Texas who call me up, and lawyers, the school lawyers come up and go, "What's the big deal?" And I'm just like, "Shut up. Go,
Yes.
Come up and live in my house for a little bit. Come on."
Exactly. So this question is, it's down the line. I don't want to really take us too far down because we don't know, things
Sure.
are changing daily. But since you are here and
You bet.
can offer
Hey.
us legal insight, and to be clear, I wish I didn't have a mask on and we weren't discussing any of this.
Me
So
too.
let's start with that. But let's say, just looking at legal obligations, and what the obligations are and what the options are. If, we have several unmasked people here tonight,
Sure.
yet we have a mask, the district has a mask policy. So looking ahead to fall and the mandate, say, is still in place, what legal obligations do the building employees have to enforce the mask mandate with students?
It's a game changer.
And what is that gonna look like?
Oh, it's a game changer, I think, because realistically, a lot of districts at this point, because of board meetings, it's where students are, expected to be present. We're out for the summertime, so in terms of kind of a lot of fidelity to that, and with a lot of people being vaccinated and the lack of clarification on that, it's quite frankly less enforced. If we were during the school year, and there were students, like a student rep to the board, or employees that were obligated to be here or coming, like teachers and stuff like that, and attending during the school year, the obligation to have fidelity to the mandate goes up dramatically. And that's one of the things that, as much as it's and it probably will be subject to litigation, but right now, that's why I think some of the guidance that's going to come down is going to differentiate on the mask mandate between vaccinated and unvaccinated. So it may be a situation where we're having school next year, or having board meetings next year in schools where students are present, where there will be an obligation to enforce a mandate for a certain group versus another group, which I know, it's hard to go ahead and look at, but when they're looking at what Wayne, the rights of knowing who's vaccinated versus unvaccinated, when they're looking at 600,000 dead and counting in the United States, that's where the Secretary of Health Authority, that's where the authority of the local health department, and also Reichdell. OSPI technically has authority to exercise. You do have local control in many ways, but the state board sets curriculum. If you actually have a bunch of students that if you said, screw it, we're going to shut the school down, OSPI has the authority to come in and run the school district. So we're kind of testing a lot of the authority that's out there. I go back to the health stuff. K-12 students right now, the mandate is regardless of vaccination, they will be masked. If there are K-12 students who are obligated to be in a building because of basic ed and attendance under the schedule 5 days a week, and there's someone that shows up that is unmasked, that's where, in terms of the spectrum of what I would say is the regulatory burden and obligation, I would say if somebody didn't enforce it, like a principal said, hey, I'm not enforcing it, I would go ahead and say, well, let's talk to HR and have a little meeting, because the reality is you're violating the terms of your employment. And that's the scenario. Summer school, summer right now, it's a little bit of a different animal. But that's why it goes back to what I said, which is, I want the guidance. I've been calling saying, you guys can't just give it to us on August 19th, because we have to digest it and we have to message it to the stakeholders of the school district. We have to message it to staff. It's like, that August should be a time of celebrating and getting ready for kids coming back to school, not going, what the heck is this? I think social distancing is going to go away to some degree, because they went to 3 feet instead of 6 feet, because they knew realistically you couldn't put all the kids in a building 5 days a week. And social distancing is great, but one of the things that I always thought was a pet peeve was, okay, you want us to socially distance kids 6 feet, but we can put 80 of them on a bus and put the windows down? Come on, right? That's kind of ridiculous. So I think the social distancing, they want to maintain that enforcement. But I think masks and vaccination are going to be the focus. And ventilation, which this building obviously has beautiful vaccination from what not vaccination, it has beautiful vaccination. Beautiful ventilation, excuse me.
Thank you. Yes.
Back on Lori's, David?
Sure.
So, and this may not be a question for you, but under what Lori was just saying, what are you seeing teachers do in the classroom in the moment with the kiddo that doesn't have his mask on, won't wear his mask? And maybe this is your question, I don't know, but what?
I can tell you what the law is. The guidance right now currently is if a student refuses to wear a mask and does not have a specific medical exemption for masking, and if they have a medical exemption for masking, that creates implications on who they can be around and how they can be around with staff, right? All of a sudden we have to go ahead and go, guess what? You as a staff member need to have an N95, you need to have a fit test, you've got to have PPE in place. There's a lot of things that are associated with that. And right now the guidance is that student's experience is going to be different than other students' experience because of that issue. If you have a teacher that goes ahead and has a student that in a classroom refuses to mask up, they basically would take the student, take them to the nurse's office. They have to have a place where they can basically kind of have them try and talk to them and say, why aren't you wearing a mask? Talk to the parents and say, why aren't you wearing a mask? There are certain parents that have said, my kid's not going to wear a mask. And there's districts that have called me up and I said, well, then you can't have the kid at the school. There's got to be something that's associated with the reason for masking so you can game plan it. Some students, we have students with behavioral issues, and certainly in closed classrooms and things of that nature. That's where other staff are given certain kind of protective material. Staff ratios have gone up in those environments for safety purposes. We've had dedicated transportation. So there are a lot of things. It doesn't mean the student gets busted, right? But that's one of those things where we're ever mindful of a student who's unmasked for any reason. That's why the 6-foot distancing rule, odds are the one place you will continue to see that is when they're eating. Because basically kids are going to go ahead and want to eat and do that stuff, and that's going to be one of the greater focuses. But all staff have the obligation to go ahead and enforce the mask mandate. And the principal and the nurse, whoever the COVID coordinator is for the district, need to be able to start communicating with parents and say what's going on.
Okay. And then I'll just, one more question.
There's no limit. Go ahead.
Well, we're going in order here. So I know we don't know what any new guidance that's going to come out yet. Do you see a potential guidance where the governor or the State Department of Health would regionalize these decisions? So if one region is 75% vaccinated, they may be treated differently than a region that is 50% vaccinated?
I think it may be based on community vaccination percentages are going to impact mask deployments in schools, just fundamentally. So if they do it on the county level or they do something like that, I think it is something that will be impactful over that. I think also one of the things that will be a factor, I believe, this is my opinion, this is not law or rote, but is vaccination percentages on staff and people in the building. Is the higher vaccination right now? I mean, for the anybody football fan, I'm assuming you have Seahawks fans here, right? Let's be honest, okay? The NFL just said, look, if you lose a game because of COVID, it's forfeit, it's gone. And the whole point of that is they're trying to incentivize vaccinations for the teams. And so the idea is vaccine incentivization. That I think will happen. I think the regionalization, I think it'll probably be county level because it's a county health department. It makes more sense. But honestly, the one thing we don't want is we don't want to have, hey, the people down in Tri-City, my clients down in Tri-Cities are like, hey, screw you, we're just doing whatever. And that region goes distance, and then you have, Whatcom County and those people, and they're like, we want to mask up, we want to be in hazmat suits like a Spielberg film and everything else. That they're worried about that regional adjustment, because the authority of the governor is consistent across the board. So I don't know how they're going to do it. I think the first thing to happen, honestly, is what Secretary of Health and what the governor does. And then the place that I look is what is the updated guidance coming out of OSPI. The L&I employment stuff is the L&I employment stuff. That's just kind of there for all employers and everything else. Unlike private schools or private employers that have the right to say you need to be vaccinated, school districts, it's a lot more complicated. So,
Thank you.
sure. Can you guys hear me okay? Okay, I'm sorry. I'm a blowhard, but that freaks me out. What's that?
It's just another mic.
Ooh. Okay.
Hi.
How you doing?
Okay, you're back. And I think it's a little ridiculous, at least for me, when you watch like the NBA finals and you have basketball players sweating and all over each other for an hour, and then they go back to the bench, put a mask on. It's just sort of
Sure.
ridiculous. So I know I've heard that sometimes that if the state reaches a 70% vaccination rate, the governor would lift the mask. I don't know what the statewide vaccination rate is as of today. I don't know if you know, but
I don't. I was reading about Canada.
What?
Canada's kicking our ass. That's all I know nationally.
Okay, but I mean, what if the state got to 80%? Do you honestly believe the governor would lift the mask mandate for schools even if we're at 80%?
I would never presume to know what is in the mind of Jay Inslee.
What'd you say?
I would never presume to know what is in the mind of Jay Inslee. So I don't.
Okay,
I don't.
okay.
I don't know.
We agree on that.
I don't
We agree
know.
on that.
Yeah,
Okay.
so.
if the board was to lift the mandate violating the law, I know the risk management pool represents the school district in the event that they were to get sued or something like that, a child or teacher or something like that.
Sure. Like tort. If there's a tort lawsuit, somebody gets hurt, like somebody hits, school bus hits somebody, or somebody falls down, or somebody does something bad to a student, or happens, Yeah.
Right, so, but where I was going with that is if the board was to vote to lift the mask mandate, basically, you're recommending to the board that we not do that under as our, basically our risk management pool. If we did lift the mask mandate against your recommendation, and then someone got sick and died or whatever because of that, would the risk management pool still represent the school board?
Well, I guess it's a good segue to making a point. I do not represent the risk management pool. I am an attorney who is retained vetted and retained, and I've been doing it for a couple decades now.
Okay.
But I represent you. So I'm your lawyer for the purposes of if you had said tonight, Charles, we want to have an executive session and talk about risk related to this or something like that, that would have been a privileged conversation, because I'm the attorney for the district. We're doing this publicly because you guys wanted to inform everybody and give them a sense of it. If you went ahead and did that, I guess I could say, first of all, it would be against my advice as your counsel. And you could say, Leach, you're fired, get out of here. That's within your rights. But in terms of coverage for that type of thing, I think it is realistic for any school district to presume, in my mind, that if they went ahead and they went against essentially what is the directive of the governor, the medical directive of the Secretary of Health and the county health department, as well as likely violating maybe the terms of their collective bargaining MOUs for staff, L&I, and everything else, that you probably would jeopardize, and I'm not a coverage attorney, the obligation of a risk pool or even an insurance company, depending on what district you are in the state, to go ahead and cover the natural, sequelae, if you will, of that decision or that departure from advice. One of the things that it is a defense to you for exposure generally to say, we did it on the advice of counsel. You can go ahead and somebody could, sue me for malpractice or something like that. If you said we relied on, if I said get rid of the mask mandate and then something happened like that, somebody could go after me for that conceivably, right? But in that particular case, it'd be just like when you make a decision. If you went ahead and I'm your employee, say you have a general counsel, and I'm your employee, and I go ahead and say, you need to keep the mask mandate, and you tell the superintendent, and this is all hypothetical, Preston, so and fire that guy. And you're like, well, he works for us. Fire him because he told us to go ahead and do what I didn't want to do. You guys all decide we want to fire Leach. That's not something that I would say would be, regardless if it was me or anybody else, a reasonable thing. It would be kind of violate what I would say is what the right thing to do under the law is. That's not something a school district would be covered under its insurance, because you made a decision deliberately to go ahead and violate essentially the law, or you specifically retaliated against me for me saying you had to do this and you didn't like it and you violated the law. That's the type of thing that you would have to pay for, most likely. I defended some school districts when a number of unions went ahead and filed TROs, to basically say we aren't going back to school because of the issues. Now those were all resolved because the collective bargaining agreements, which I don't do collective bargaining, but I was defending the cases, was picked up by the district, because that's not something that insurance would cover. Similar to things related to regulatory actions, those are all things that would be out of your pocket. Or even, we've defended a variety of things that aren't traditional torts. A lot of those are accidents, or somebody does something and we said, holy cow, we didn't know that. That's against board policy. Those are the types of things typically that would be covered. Something like that, I would say would be, I would be remiss if I didn't advise a district that was doing that, saying, you're putting your butt out. And you're putting your butt out of the money that's not just yours, it's your taxpayers, it's state money, and it's federal money. And those people all, because of their authority, could also come a calling and go, what's going on? Why are you doing this? And exercise some regulatory authority. So.
Okay, you have more? Go ahead, Chuck.
So, you had mentioned that nobody's challenged the governor or Department of Health.
The school district hasn't
No,
taken.
Right.
Yeah.
At what point? I mean, if they keep this going for 3 years,
Oh, well, I think that,
I would think this has been 18 months.
sure,
And-
okay.
And so at what point would we challenge them? Because we're seeing a spike in suicides. There's a whole lot of data out there. So at what point?
I don't know. I mean, that's first of all, it's not, that's the choice of a school district. My job is to interpret the guidance and tell you. The reality is that Inslee went ahead and did his, social emotional. That's one of the reasons he went ahead and brought kids back, right? So I mean, that was one of the things is that at the time he did that, Seattle and Lake Washington, the two largest school districts in the state of Washington, were going to be remote, basically for the remainder of the year. So in terms of the, kind of the calculation to go ahead and do that, I have no idea what the future is in that regard. Obviously, if you have students that are having issues with socialization and things of that nature and being around peers, I think the one thing you have to be wary of is whatever facilitates your ability to have 5 days a week of in-person schooling versus whether a kid is having to wear a mask when they're indoors or not. And that's why I think, and I think what I was talking about earlier is, I think that's why we're going to see some differentiation between vaccination status. So if a student goes ahead and his family makes a decision to go, I'm going to get a vaccine, I don't have to wear a mask. Versus if my parents choose with me to not get a vaccine, which is their choice, that person may have because of their susceptibility to whatever variant we're dealing with. That's what I think. I think things will change and there'll be progress. I don't think it's going to remain static, in 18 months, but I don't know, to answer your question.
Chuck, I'd like to address that. So, Charles, thank you very much. This has been a long journey, and I feel like I've had a front row seat from day one with Governor Inslee. We have had conversations as superintendents making advisory to say, at what point do we start unraveling, right? Yeah. We have instituted a mask mandate, but at what point? So your very question is what we have asked. So at what point? Is it 85%? What are the metrics by which we can start looking at, and it should be public. The difficult part is we don't even know until the day that it comes out and it's all public to you. It's also public to us. And then we have to operationalize that and figure out all of the pieces. And you're right. I believe that many of us are very, very tired, and there's no end in sight today.
Exactly.
And so what we have asked, my advisement is always, so I sit on the round table with Chris Regdahl, and we also have the opportunity to give advisement, our own opinion, what's happening, boots on the ground, to the governor's office. And what we have said is, okay, if not now, then when? If not today, then what are the numbers? Can we get a target so that we can all work together to say, we can do this as a community. This is the target. But it's a moving target. So I just wanted to add that to say absolutely what you're saying. And we can anticipate probably within the week that we're going to get a whole nother advisement and guidance.
I mean, this is something that, like we talk about, it depends. I anticipate that in the next 7 business days, we're going to get some direction. And then we're going to go through a whole nother reaction to that. But I think the bottom line is the intent to try and normalize as much as they can operationally moving forward. But you're exactly right, where it's an issue of, and one of the things districts are trying to do too is and I've advised this, you have to increase your outreach, you have to increase your student support mods. You have to do this because you can't just go, okay, we're gonna leave the kid and he's gonna play Xbox for 6 hours a day, that he's gonna be on the school computer for 4 hours a day, and we're gonna expect it's gonna be a normative experience. I mean, it's just not. So.
Yeah, while we have you, and we're throwing out some hypotheticals, you have referred several times to maybe vaccines being the key to moving us to another phase. Can you address vaccines in kids? And if there would be such an order that says vaccinated children can come to school without masks and unvaccinated has to have masks, as I understand it, we can't ask. And what about for staff? Can we ask for proof of vaccinations if that's required by the governor?
Well, right now, on staff, I can answer that's pretty easy because basically if you have vaccinated versus unvaccinated, and you have, say, staff in a building right now where students are not present, you can go ahead under the current guidance and say, guess what, if there's no students around, if you're vaccinated, you can go ahead and not have a mask on. Now, the issue is proof of vaccination. And honestly, the proof is, the gold standard is, show me the card. And some people are like, I want a copy of the card, but the reality is show me the card and check the box that HR has the card. Normally, the cards themselves are not HIPAA protected per se, but the guidance under the DOSH, Occupational Safety and Health, is you need to treat it as confidential. You need to basically put it in an envelope, but realistically, you need to have some level of proof of vaccination on file and in that person. Somebody needs to know about it. Not, hey, Bob, you're not wearing a mask. Are you vaccinated? Not that. It's more, hey, someone who's the nurse or someone in HR knows it so they can track it. That's kind of where we are, and that's where students are not present. Realistically, I think it's going to be within the authority of the school district. If they have staff that are going to go unmasked and be around kids for the purposes of safety of kids, is you're going to be able to direct, if we get to that point, which I assume we probably will, that you need to tell us whether you're vaccinated or not. And honestly, personally, being a lawyer and being typically paranoid about, signatures and writing and I'm like, I want to have somebody, human being, see it and check the box. You don't just have to keep a copy, but it's just one of those things that you want to have a record so you know. Students, I think we're heading to some place where we're going to have some information. I do not know how it's going to end up. I think one of the things is that we know that under 12 right now, they aren't capable of being vaccinated as it currently stands. So I don't know. I think the intent is to try and move forward, whether because of community vaccination statistics or whether it's because they're actually vaccinated and there's proof, to try and get away from the mask as fast as they can. But I think they still have to reconcile it with what they see as the increase of the Delta variant and concerns over that. One of the things you see a lot of statistics, I know they're worried about it, not necessarily with Delta, but maybe down the road in terms of just reacting to whatever variant comes out, is that a lot of the people that are currently hospitalized and intubated are unvaccinated 20 and 30-year-olds. They aren't. The vulnerable populations, the people who are 60 or your parents or grandparents and stuff, they've already been vaccinated, so a lot of them aren't the ones that are currently susceptible. So, but I wait to get that guidance. I've heard something's going to come down, but again, to David's question, I'm not going to presume to know what's in the heart of or the mind of Jay Inslee on this.
So, we have had, and we, potentially could in the future, have vaccination clinics at school sites.
Sure.
Do we as a district have any liability for hosting those for the students as well as broader community?
If you have somebody who's a medical professional doing it, no.
Nothing.
Don't have your school nurse doing the vaccine, but no, you don't. If your facility is being utilized, a lot of school districts have gone ahead and hosted those. There's actually immunity that's associated with the basically the federal legislation if you go ahead encouraging vaccination. Mm-hmm. So that's not, as long as you kind of follow the PrEP Act, if you kind of follow that process, which is pretty simple. But you can find that a lot of even local pharmacies and local agencies will partner. Pierce County actually has a lot of great healthcare agencies that are doing that and have done it with school districts. So, but that hosting it geographically, it should not be a disincentive.
Okay, thank you. And then kind of back to my original question when I asked about if somebody doesn't like this mask mandate,
Sure.
We're not the body to talk to. They need to go talk to the governor, State Department of Health. I also hear a lot of people saying that masks are not helpful and actually harmful to children. Who should I direct people for them to go talk to about that?
You mean in terms of like just the medical advice?
The medical advice, yeah. Who would?
Well, I think it's anybody from a primary care physician, certainly the Department of Health. There are a lot of resources out there that are physicians. I think even last night. I think it was the night before, Vancouver. They had a school district that had its board meeting public comment pulled by YouTube because of violations of terms of use because of basically people talking about things that were not supported by the science. So they're starting to get more, and regardless of how you feel about that, the bottom line is that talking to a medical professional should be able to explain that. We do know that respiratory droplets are the main means of distribution of it, and we know that the Delta variant is, depending on who you talk to, it's like 5 to 8 times more contagious than any variant that we've dealt with. So the combination of that's why, and it goes to unvaccinated, so that's why the vaccination versus unvaccination. So I'd say talk to the primary care physician about vaccines and talk to him about masking.
Okay, thank you.
You bet.
Okay. No more questions for either of you. I will say before if you've written down any questions that Charles has not answered, that the board has not asked, if you have any additional questions that maybe we might have missed and you write that down, please let Tanya know and we'll ask Charles that. I will, while we're waiting for those questions, if any, the school board does act as an advocate on your behalf. And as far as the reopening, we had done multiple surveys about how many parents wanted their kids back in school. And so we wrote the governor a letter and asked him to change the 6-foot rule to make it 3 foot so that we had the ability to have more kids back in school. He added a couple other things in there about excessive exhalation and 6 feet here and 6 feet there. But school districts across the state wrote him letters and asked him to be a little bit more flexible on his 3 foot, 6 foot, and it worked. So his newest guidance is 6 feet if possible. We prefer, 3 feet, but if 3 feet doesn't work and it keeps you from having your kids in school, 3 feet's even off the table. We want your kids back in school. So the school board can certainly advocate on your behalf by writing the governor a letter, and as well as other school districts across the state, to ask for local control based maybe off of local numbers, stuff like that. But at this point, that's probably the best that we could do would be to advocate, write a letter asking for local control based on local numbers or something like that. But,
and you raise a good point, because what happened a lot was going on is the 6 foot came out and it was out. And then they went ahead and started saying, you need to have your plan for next year. OSPI did. And a bunch of school boards and superintendents and deputy superintendents pretty much, and principals were having nervous breakdowns over that, because they literally would go around their building when they were doing a hybrid schedule. And they said, if you do 6 feet, we can't have any kid back. We just can't even make it work. And so that was the thing where they went to the 3 feet, which honestly was really hard to operationalize. It was like 3 feet in the classroom, but you walk in the hallway, then it's got to be 6 feet, and then it's like, I feel stupid when I go to QFC and they have arrows on the floor, and I'm like, oh gosh, sorry, and I can't even imagine what my 12-year-old would think about it. Is that you're in this situation where they realized that it was even a problem for in-person learning, and so they did exactly what you've talked about, which is they've basically said 3 feet, but if you can't do 3 feet, do the best you can. The priority is to go ahead and have in-person school 5 days a week. And that guidance is going to get updated. That planning guide will be updated here, I assume, in the next 2 weeks.
I have a question for Superintendent Bud. Based off your 3 weeks here, knowing the mask guidance and mandates that we have to abide by, fall of this year, if we, under current guidance, have all of our children masks, can we get 100% of our kids back into schools 5 days a week?
We will get 100% of our students back in 5 days a week. We will.
Okay.
And we will have athletics, and we will have clubs, and we will have those things that touch the hearts and souls of children and are necessary. Now, whether we have masks or not, that's out of my purview, as you've heard. But we will have it, and we'll make it work. I've been flying, and I was right next to people, and we all got on the plane, and we got there, and we landed, and we were good. So if that's what we must do, that's what we must do.
Well, and also one thing to keep in mind too, the outdoor mask requirement has dropped, right? So it's one of those things where you have that. It used to be, it was a big issue to try and go ahead and have them tell us, okay, can we have recess with elementary kids running around as long as they aren't like tackling each other and hugging and stuff like that, to have some normalcy. So the outdoor masking has slipped, and so I think we're seeing it's, I don't think it's gonna be 18 months, but certainly obviously grades of of changing. And I think it goes back to the vaccine percentages. If you turn on any news channel, they're talking about vaccines right now.
Charles, and the quarantine rules have also changed,
Sure,
because
they've-
that was very irritating for parents, that
Oh,
if
heck
they were
yeah.
a close contact, then
Yep.
they would have to be out for that amount of time. And that has changed for vaccinated students and staff as well.
Correct,
So
correct. And-
we
and-
anticipate that those things are going to change, and who knows what they're going to change to, but
Well, and I think they've done the same thing too, where they started sliding because there were 14, then it went to 10, then to 7, in circumstances. There are some districts that still have people on staff, like nurses, that are saying they want 20 days. I mean, it's not just like everybody's like quick to abandon everything. So it's one of those things, which I think is the wrong way to go, obviously, and not supported. But so I think it may seem glacial, but we are making progress, at least in terms of our flexibility under the existing legal and regulatory scheme, I guess is the way I'll say it.
absolutely. So I did want to add that we will also have a remote option for families. The remote option was a positive for many families and a necessity for other families. So we will also have the remote option for those families that works. And we'll just work family by family and figure out what works for you. And it might change throughout the year, right? As vaccinations become available for the younger and younger. And we don't want families to feel like they made one decision for the entire year. I know we really talked about that last year. And so just knowing that things are changing, we've gotten very adaptable, so.
Yeah. Well, and Governor Inslee went ahead and because a lot of districts that had gone ahead and planned and game planned virtual, they said you have to make this decision and that's your choice. And then they had an apoplexy when Inslee said you can make a choice anytime. So you could have someone going, I want to go to this week and now I want to go to school the next week, and you had to have that flexibility because of the mental health order and emergency order. So.
Okay, Charles, we have a question from a member of the audience.
Sure.
Johns Hopkins study shows morbidity rate for children under 18 without serious comorbidity to be 0. The evidence also shows children do not transmit to others. If the teachers are protected by vaccine, who are masks intended to protect? Why, that's question one. Why would I vaccinate a child who is healthy and a 0 risk from COVID?
All right. Well, I'm not a medical doctor, so sorry. The first thing I would do is I'd call a medical expert and talk to the Department of Health and everybody else, because of the nature of. I'm not responsible for individual vaccination decisions. I don't mean to do I'm trying to shimmy out of the question, but there's literally. I have this many studies that keep on coming in that say various different things. There's no question that we know schools with students, by and large, for the variants that have been documented and tracked, spread less than we originally thought. That's one of the reasons that the governor went, as I understand it, to the hybrid order with the mental health emergency proclamation, because of the concerns that were basically demonstrated to be a little overly focused upon. In terms of, a study, I haven't read the study. I will certainly go look at the study and see what there is. It doesn't change. You can't go ahead and rely upon a study from Johns Hopkins, or, I was on the phone with somebody from Brown, who had opinions, but even, he acknowledged, look, it doesn't, what's your Secretary of Health, Department of Health, and local health directors say. So those are the individuals you should send the study to, because I'm not going to be in a position really to evaluate that. So.
Thank you.
Can I mention? So
No.
even CDC numbers demonstrate that same thing,
Talk up.
that the youth are not at risk. They're
Can't
not.
hear it.
Well, I mean, you're correct. I mean, I guess the CDC numbers, but CDC also is. I mean, right now everything's in flux in terms of your reaction to it. I mean, it's honestly a situation where I'm not, and I don't want to seem like I'm not here advocating for an interpretation of medical guidance. Okay, I'm here to tell you what the legal regulatory landscape is. If the Secretary of Health and the Governor's Office and OSPI and the Pierce County Health Department say it's okay to unmask, and not care about vaccination status, then do it. But if they tell you something different, they have the authority to do that. So I'm not, I mean, and the situation is, and the problem is, there are parents, just regardless of how you feel, there are parents and lawyers of parents and lawyers of employees and employees that are taking the American Academy of Pediatrics study that just came out that said everybody should be masked regardless of vaccination status, and emailing it to board chairs, superintendents, and healthcare department, doctors right now with that. So I mean, the issue is that you don't have an infectious disease specialist on retainer, and nor should you, because it's not going to make a difference necessarily. We need to see what they do and react, unfortunately.
Okay, I have another question from the audience. And I'm hearing mixed on this, so I don't know the answer to it either. So whether it be COVID testing of our children beginning in the fall, and if so, can parents refuse? I don't know if that's for you or for Charles, but whether it be COVID testing.
There may be, but I don't know. It depends on the department, what the health kind of mandates. I don't know if testing is necessary. This is what I've heard, and this is not legal opinion, but what I've heard is that with increased vaccination rates and with that, testing is going to become less important. I think the attestations will stay in some fashion, but I don't know if we're going to do temperature checks and stuff like that. I don't know, but in terms of vaccination testing, there may be testing associated with extracurriculars. Like if you're going to go ahead and have a bunch of people doing wrestling. Wrestling was a very famous thing for any of wrestlers. At the end of last year, all of a sudden it was like, you're going to get tested because of the nature of the sport. So there may be some testing things, but in terms of attending and going to school, normally what districts have done is made testing available if they want it. But certainly, as what Creston raised, which is the fact that if you're vaccinated, if you have a positive test, the quarantine rules are lessened.
Because I was just hearing that vaccinated students would not be tested at all, but unvaccinated students would be tested twice a week. So is there any truth to that?
I haven't heard that.
So I can speak to that right now. So we are looking at the option to join the Return to Learn, which is a coalition of school districts throughout the state, sponsored by Sound Partners. Sarah Sutton, it's out of the Department of Health. However, we have been testing here in Peninsula School District, and I would have to bring forward our plan for the fall. I know that we have tested vulnerable populations and staff who have had vulnerable populations, as well as they have been using more prescriptive masks. So as I'm here for longer than 3 weeks, I will make sure that those are, that information is available. I would say that we would have COVID testing available, not forced. COVID testing will never be forced on a child against their parents' wishes.
Yeah, and I think the other thing that also is on the testing directives, if you will, versus, everybody has a choice to make, right? It depends on whether that's why you have the virtual option and everything else, is also, what is your health department telling you? Because I've had health departments during the course of the last school year go ahead and say, okay, you've got this problem, you're going to jeopardize your in-person learning, this whole cohort, you need to test them. And if they say, well, no, then the Department of Health is going to tell you have to take them virtual. It's for a longer period of time. So a lot of it's reactionary. There's more than one cook in the kitchen, unfortunately, on that. But I think you're going to see less testing. I do believe this next year, sincerely, if vaccination rates are up.
And we do know that WIAA is still, they have not come out yet. And so in order to be in sports where that status is, we don't know.
And the other thing about WIAA is a rulemaking and does clinics and rules and basically orchestrates sports. They are not the end-all be-all for when and how sports can occur. A lot of the orders that came down from Inslee on sporting activities were the dictators of what was going on versus WIAA interpretation. So it's another one of those things where we have to get the guidance, hopefully with some time, and we can operationalize it and probably have some fault discussions and go, well, this doesn't make any sense. Can we fix this?
Yeah. So I have another question from the audience. If I don't read this quite right, feel free to stand up and ask, rephrase it. But question is, what problems do you see might come from masking some kids and unmasking others based on a family vaccine choice?
Oh, I think, first of all, I think you have to redirect any students that would go ahead and target or make fun of that kid. I think you need to worry about harassment, intimidation, and bullying, and anybody treating them differently. I think we still have an obligation to go ahead and treat every kid in an equal fashion. And I think all staff would have to respect that decision. I think if a staff member or someone made fun of one person for not being vaccinated or being vaccinated, I think that staff would have to be told they can't do it. And I think any peers that went ahead and acted towards that, we would have to as well. I think that you have an obligation almost this year with that circumstance of increased supervision and a duty to protect all those students that have made that choice with their family and respect that choice. I mean, there's implications for the choice. We aren't to a point where it's, vaccines are mandated, and I'm not going to say they will be, and that's not where a school district should go or will go as far as I'm concerned. But in terms of that type of stuff, we need to be very clear that we're just going to not treat them differently.
Okay. Looks like another question making its way up.
Isn't allowing them to participate in certain things treat them differently? I mean, does that open you up for liability?
It's a good question, because one of the things is that if you do have changes in their academic experience because of whether they're masked or unmasked, or the mask negatively impacts their participation in activity, it's certainly one of those things that I think the district would have to, I think hypothetically, as I think about it, because I helped write the harassment, intimidation, and bullying model policy and procedure for the state a long time ago. So I think you have to be very mindful of how to mitigate that impact. I mean, the one thing that when I've had conversations just kind of anecdotally with Department of Health people, and I go, well, this is, I'm not going to say the word I actually said, but this is not the way we should be doing this. It's hard to operationalize, is they go ahead and they just start looking at mortality lists, or, I literally had an infectious disease doctor pull out, an expert that I actually met with back east, pull out basically a file with autopsy reports. And I'm like, well, what am I supposed to do? I look like a jackass if I go ahead and go, well, okay, sorry, but it seemed like very overly dramatic. But I think we've got to try and work through it in an equitable fashion consistent with district policy and procedures, and as much as we can, and it's hard. I mean, I've been busier than heck doing this work, and teachers and staff of schools and parents, all of us, we've all been through it, man. We've been through the ringer. It sucks. It sucks. And we need to try and stop it impacting kids as much as we can. And I just want the guidance to come down fast so we can look at it and continue to try and be successful against COVID and move forward.
Okay. I have another parent. I know as a parent myself, when a student enrolls in a sport or something that may be a risk, the parent has to sign a waiver or liability saying, hey,
Yeah.
You're letting your kid play this sport. You can't hold the district liable if they get hurt, yada, yada, yada. So this member of the audience said, if we are worried about liability, why not have parent choice waivers?
There's no way a parent, this becomes a surprise to you, despite the fact when you go out and you take your kid out and you have them go ahead and do an activity, parents cannot release future claims of minors, even their own. You cannot release, if I go ahead and my son breaks his leg, and I go ahead and go, hey, let's settle this case for whatever, $10,000 or some number. I can't release his claim. I can't sign the release saying we're done. I have to go ahead and physically, with my attorney, appoint a different attorney called a guardian ad litem, who will go ahead and look at everything, go in front of a judge, and have a judge sign an order that says his claim is released. Or I give the authority to the parent or the GAL. So if you go ahead and sign a release, that's why when you even do releases, or not releases, waivers, or I don't know what you guys call them, acknowledgement of risk for sports, like football and all those forms, just because you do that doesn't mean if your son or daughter or child goes out there and gets hurt that you can't sue the district. Trust me, I would have advised school districts, even though I might, burn in Hades for it, I would have said, yeah, go ahead, make sure they can't sue you if they break their leg playing ball. Can't do it. It's not effective under the laws of the state of Washington. You can go ahead too, you can make an argument even for adults that you could say there's what we call express primary assumption of risk. But the thing is that we don't know how it'll impact kids. We don't know how, I mean, for instance, just the Delta variant doesn't have the loss of smell and taste like the earlier version. So in that sense, I guess it's better if you get it, but it's more contagious. So, I mean, at this point, you can't have those releases. And that was one of those things that literally when we first came back to school, that I was getting asked that question by every superintendent and school board, because they were like, look, can we just go ahead and have parents make this individual choice? Now, the reason behind that in the laws of the state of Washington, I think, is the idea that, you know, your parenting decisions could be, you know, releasing a claim that someone could have later on when they're at an age as a 9 or a 10 or a 16-year-old where they can't. Now, an 18-year-old, technically, I guess, could release that. But again, that would fly in the face of Department of Health Authority. So it's a good question, and it's one that districts have encountered quite a bit since we started down the masking road.
Okay, thank you. So with all board questions been answered and more community questions, I would say thank you, Charles, for your time.
Again, I apologize for being the bearer of any bad news for anybody. So I'm, you know, that's one of those things that it's believe me, I can tell you from my heart of hearts, if I can advise school districts to ditch the mask mandates and to go ahead and move forward, when I can, I certainly will. So, and thank you for all your work, and thank you for you guys participating. It's exciting to see a group that's motivated despite the fact.
Next up is item number 6 on the agenda is approval of resolutions. First up is resolution number 21-27 regarding local control of CSC curriculum. I'll read it and then we'll have a motion and vote. Whereas RCW 28A.300.475 requires all public schools to provide comprehensive sexual health education by the 22-23 school year, with some requirements beginning earlier, whereas the curriculum, instruction, and materials used to provide comprehensive sexual health education must be medically and scientifically accurate, age-appropriate, inclusive of all students, whereas the new requirements allow flexibility of the Peninsula School District number 401 and local decision-making when creating curriculum, but must also align with Washington State Health and Physical Education K-12 learning standards, the January 2005 guidelines for sexual health information and disease prevention developed by the Department of Health and the Office of the Superintendent of Public Instruction, and the social and emotional learning standards and benchmarks for grades K-3. Whereas the Board of Directors of the district holds true its responsibility under state law to establish final curriculum that aligns with relevant and applicable laws, and whereas the Board of Directors acknowledges its responsibility to allow parents, families, students, and staff the opportunity to provide input with regard to potential use of curriculum and educational materials prior to finalizing any curriculum and/or materials related to comprehensive sexual health education. Therefore, let it be resolved, the Board of Directors of the Peninsula School District declares, individually and as a board, the district will notify parents prior to any instruction taking place regarding comprehensive sexual health education and provide the opportunity for parents to inspect such curriculum. Pursuant to applicable state law, the district shall annually provide the Office of the Superintendent of Public Instruction any curricula used by the school to provide comprehensive sexual health education and describe how it aligns with the state requirements. Because the Peninsula School District currently meets all state requirements, the district will continue with its current curriculum, and parents may choose to excuse their students from participating in instruction related to comprehensive sexual health by submitting a written request. Will now be, is there a motion to approve Resolution 2127?
I move to approve Resolution 2127.
It's been moved by Lori. Is there a second?
I'll second.
Okay. It's been moved by Lori, seconded by Natalie, to approve Resolution 2127. All in favor, say aye.
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 All opposed? This resolution has been approved. Next up is approval of Resolution 2128 regarding state mandated training for staff and school board. Whereas the Washington Legislature passed Senate Bill 5044 in 2021, which requires all school staff and school directors to participate in professional learning concerning equity, cultural competency, and dismantling institutional racism in the public school system. Whereas Senate Bill 5044 does not contain requirements relating to instruction for students, nor does it define or mention critical race theory. Therefore, it is not under this board's purview to evaluate or enact policies based on the term. Whereas the Board of Directors of Peninsula School District Number 401, the district, takes its obligations and responsibilities to abide by applicable laws relating to professional training seriously and will uphold the legal requirements set forth within that bill. Whereas the Board of Directors acknowledges the various community reactions in responses to the passage of Senate Bill 5044, therefore be it resolved that the Board of Directors of the Peninsula School District declare the following. The district has been devoted to fostering an environment that is inclusive and continuously works to model and create an environment free of discrimination. All students, teachers, and support staff are equal as individuals, and no one race, gender, ethnicity, or religion is superior or inferior as it relates to another, and no student, teacher, or support staff member should be taught that they are an oppressor or victim based on their race. Pursuant to Board Policy 3210, any form of discrimination with regard to race, religion, creed, color, national origin, age, honorably discharged veteran or military status, sex, sexual orientation, gender expression or identity, marital status, the presence of any sensory, mental, or physical disability, or the use of a trained dog guide or a service animal by a person with a disability is strictly prohibited. All training and instructional materials used to train staff pursuant to Senate Bill 5044 will be consistent with all applicable requirements of the law and will reinforce the district's declaration in Board Policy 3210. There will be no additional or modified student curriculum, including critical race theory or instruction in response to Senate Bill 5044, as it does not mention or require additional instruction for students. The district will continue to teach a complete and accurate history that is inclusive and without bias. Can I get a motion to approve Resolution 2128?
I move to approve Resolution 2128.
It's been moved by Natalie. Is there a second?
I'll second it.
It's been seconded by Deb. It's been moved by Natalie, seconded by Deb to approve Resolution 2128. All in favor say aye.
Aye.
All opposed? It's been approved 5-0. Okay. Moving on to 7 on the agenda, community comments. Tonight we'll take public comment. The board recognizes the value of public comment on issues related to business, the district business. In order to permit fair and orderly expression of such comment, the board provides time for public comment during each regular monthly board business meeting. As a matter of practice, the board will not respond to comments or engage in dialogue at the meeting. Most issues require that the board review all available information before making a statement. The president may request the superintendent delegate the response to the appropriate PSD staff member. We appreciate your understanding and cooperation. Prior notice has been communicated to the public on how to register to speak. All commenters will be allowed one at a time to speak to the school board for up to 3 minutes each. Board Policy 1430 states in part, the president may exercise discretion to interrupt or terminate an individual statement when it is too lengthy, personally directed, abusive, obscene, or irrelevant. So, Tanya, how are we doing the time? Still on timer? So I have a list of, or a stack of cards in the order that they were received by Tanya. So I will read your name, and please come to the podium and remember to speak into the mic so we can all hear you. First up is Joy Stanford.
Good evening. Thank you. Welcome, Superintendent Barr. I haven't got the opportunity to meet you face to face, but I want to say welcome. Sorry you have to deal with all this, but Welcome to our little town. Good evening to the rest of the board members. I'm here as a mom of a graduated student and a member of this community and a member of the Diversity, Equity, and Inclusion Council with the Peninsula School District. My question tonight, and I'm not going to speak for anybody else, I'm going to speak for me, is with this resolution that you just passed, what happens to our council? What happens to our committee? It includes teachers, administrators, students, and educators on that committee. We spent probably 4 years trying to bring some policies before the board of directors for our school district, but we've had barriers put in our way. So I believe the question is, why this resolution and why now? There is something behind it that hasn't been said, and I'd like the answer to that question. As a mom of a student of color who attended our schools, Peninsula High School in particular, the resolution is saying to me that maybe our kids of color don't matter. There's not a lot of us and we're not going anywhere, so I need to know that we matter. What you're also saying is we're going to continue to ignore, erase, and be silent about the history of this country. The real truth. With Senate Bill 5044, that curriculum is reserved for just administrators, educators, and not students, but educators in the school district. So why this resolution and why now? What is apparent to me is your silence is deafening because you all were not there, and I had to watch, I'm trying not to get emotional, the video from last Tuesday night, this meeting in the community that I didn't even know was happening. I had to watch that, and what it says to me is that the kids of color don't care. We don't care about that. Doesn't matter. We have no students, or excuse me, educators of color, maybe one, maybe two, but no black. That's concerning to me. My son went through this school district 9 years, with not one teacher of color. And that's what he went to college with. And the day he got a teacher of color in college, he called me and said, "Oh my God, I love this teacher." It makes a difference to see somebody reflected back at you. It makes a difference. I had a conversation with these kids. Guess what? I had 4 teachers of color during my schooling. That's important. And I want you guys to keep that in mind when you're doing these type of resolutions. Thank you.
Next up, we have Twyla Slind, or Slind, if I missed, Slind.
Slind?
Thank you.
Well, I guess I thought you were going to listen to people before you decided to ban something from our schools or an idea. So I don't know if what I'm going to say is really, I mean, I was going to try and talk to you about the importance of having equity, diversity, and inclusion and anti-racism. Let me just tell you a story. When I was a young mother, a long time ago, my 5-year-old son was playing with a Jewish boy. Christmas was coming, and my son said, "We're getting a Christmas tree and presents, and it will be Jesus' birthday." His friend said, "We don't believe in Jesus." And my son pushed him down. I couldn't believe it. I knew that my son rarely hit or pushed, and I had never thought and never taught him to dislike someone who didn't share his beliefs. The problem was I hadn't taught him anything about people who were different from him. And I wish I had learned in my training that when you say nothing to your children about people who are different from you, they can develop inappropriate responses, and eventually that will hurt others and hurt themselves. I have seen children shrink away from disabled people because no one has taken the time to talk about people who move differently than them. I have seen a child say hurtful things to another child because of the color of the skin of that other child. If teachers do not know the appropriate responses to these kinds of situations, our children suffer. And I want our teachers to get this most important training. And I want the training not to be censored by some ban that is put on, that can be then brought up by some other parent saying, well, you know, in my opinion, this is part of that, you know, critical race theory. And I think you should, you know, I'm going to raise hell. I sure hope that doesn't happen. I really do. Cultural competency is a good thing. Thank you.
Thank you. Next up, we have Lisa Marcus.
Good evening. I speak to you this evening as a mom of 2 daughters educated in the school district. My youngest will be a sophomore this coming year at Peninsula. I am also an educator, and I'm grateful for the instruction my daughters have received in the district from excellent and committed teachers, counselors, and principals. I gather that the school board has been put under pressure from some community members who wish to impose censorship and restrictions on what can be taught, particularly regarding American history and in relation to comprehensive education about sexual health. I appreciate that the board has put forth 2 resolutions responding to demands made by the censorious pressure groups, and that these resolutions affirm the district's commitment to diversity, equity, and inclusion, and to comprehensive sexual health education. I ask that the board not cave to these special interest groups. I and many who are here tonight are also part of this Peninsula community, and we don't want to be silenced or railroaded by the radicals who have fallen for a manufactured campaign against a theory that isn't even taught in our schools. Students should be able to learn about our history, the good, the bad, and the ugly. They should not be censored from knowledge of the past. We cannot agree to their agenda to create future citizens who do not know the history of our country. I teach Holocaust studies at a local university. What if German citizens decided that continuing to teach about the Holocaust was divisive and a roadblock to national pride? What if they decided that studying the Holocaust would make the current generation feel guilty? That it was time to stop remembering what happened on their soil and in their communities? What if instead of never again, they decided to say, never talk about it again? I would venture to say that almost everyone in this room would agree that this would be unacceptable and dangerous. Those who wish to censor our history, our books, our curricula, would place us on a slippery slope toward a dangerous kind of national amnesia. Our kids need to know the past, they need access to diverse perspectives, and their teachers need training to educate them with sensitivity and compassion. Thank you.
Next up, we have Tim Gates.
Hello, my name is Tim Gates and I grew up in Gig Harbor. Although I left for many years, I came back here to raise my children when they were in 2nd and 4th grade, and I'm here with my wife, Amy. Before I begin, I want to thank the Peninsula School Board. I want to thank the amazing administrators, staff, and teachers of our schools. They're absolutely incredible, and I would not be where I'm today without all their help, support, and development to help me grow. I grew up with my 5 siblings here in Gig Harbor. We moved here when I was 2. 3 of my siblings went to Peninsula, and 3 of us went to Gig Harbor. We were here during the time when that school was built. And I attended Harbor Heights, Goodman, and graduated from Gig Harbor in 1986. My daughters went to Voyager, Kopachuk, and Gig Harbor High School, and they are now well on their way based on the great education we got here. After school, I left Gig Harbor and went to University of Washington, got my degree in business administration. And in 1990, when I graduated, I entered corporate America. And I've been in corporate America for 31 years. And that's the perspective I want to share with you, is the importance of preparing our youth for the future. I've worked most of my time at the Nestle Corporation as a vice president, primarily. I've spent some time with Campbell Soup Company as a vice president. And I've most recently returned to Seattle to work on a joint alliance between Nestle and Starbucks on a global coffee alliance. So I come to you with 31 years of experience in corporate America, and what I want to share with you is the importance of diversity, equity, and inclusion. There's not one company in America, and quite honestly, I work for an international company with 339,000 employees around the world, that doesn't focus on this and look to continue to expand our perspectives, our learning, our insights. And I really just want to say how important it is that we continue to expand what we're doing with our students to appreciate that. It is super relevant for our employees to compete in the marketplace, and we need them to do so to be successful. So I really implore you to continue to look at expanding what we know about it, how we expose our students and our teachers to it. And the most important thing I want to say is these are not radical ideas. These are very simple, easy to understand, and our students are demanding exposure to them. And our employers are demanding that we raise students that have been exposed to them. And I want to say that the other thing I want to just say is taking extreme positions in any of these areas does not help our students to achieve. And I trust our teachers. I think Pam Wise was in the room earlier. I don't know if Pam is still here. She might have left earlier. I tell stories to groups in my company about the lessons I learned from teachers like Pam Wise on accountability. And I trust our teachers to handle this content, and you should too. Thank you.
Next up is Ben Pinio.
Good evening. My name is Ben Pinio. I teach English and social studies here in the district and have for 13 years at the middle school and high school level. And listening to everything tonight was making me reflect on how I wanted to begin. And first, I wanted to come up and read the state social studies standards. There's been so many discussions about critical race theory that don't even get into what are we actually teaching right now in our classrooms. And we have tremendous educators in this district who are all following the law, following board policies, following the expectations that our principals set out or evaluated every year, and are doing amazing work. And I was thinking about our students as we teach them civics education so they can graduate and become well-rounded, well-educated voting participants in our democracy once they turn 18. And it'd be hard to teach them the civics behind this tonight, because the resolution that we heard tonight, 21-28 about critical race theory, we heard about it first at a forum last week, and then we got the board agenda 2 days ago. We were able to see the resolution yesterday, and then we didn't get to discuss it tonight before it was voted on. And so I'm having trouble understanding the civic process behind that. I'm sure that's the way the board operates, but I think there's a lot of people in the community who probably don't agree that's the best way to handle a controversial resolution. But I also wanted to start tonight just talking about love and empathy. When I attend a movie at the Grand in Tacoma, there's a placard that a screen that comes before the movie that says we are on Native Indigenous tribal lands, and thanks and honors the Nisqually people, thanks and honors the Suquamish people. We're at our elementary school here tonight named Swiftwater in that honor, and here we are talking about a resolution laying out what we do and don't teach in our district. And there was a very offensive comment made at that community forum last week about basket weaving, just terrible, racist, offensive across the board. And they wanted to prioritize the teaching of Abraham Lincoln over basket weaving. and as if that is what Native Indigenous teaching in our Washington State histories curriculum, our state social studies curriculum comes down to. And it's also not a binary. We don't have to choose one or the other. We teach both. And we teach how the Iroquois Confederacy led our 13 colonies and our founding fathers to decide that we were going to have a confederacy of independent states inspired by that Iroquois model. I had a lot more I wanted to say tonight, but I want to just focus on love and empathy for our BIPOC community of students and families, and the decisions that you all make and that we make as a district send messages about our values and our beliefs to those students and to those families. And to say we are going to have a state-sponsored training on diversity and inclusion under Senate Bill 5044. But tonight's resolution 2128.5 says that nothing from that training is going to be taught. Why are we doing professional development for our teachers about diversity, inclusion, and equity if we don't want to then inspire students to see those same ideas in our own community? Well, thank you for your time.
Next up is Jim Albrecht.
Good evening. I speak also as a parent and an educator. In many ways, there were many things about the resolution that I could support because it affirms that the district will fulfill its legal obligations to administer the diversity and inclusion training for teachers required by SB 5044, that the district is committed to creating a learning environment that is inclusive and free of discrimination, that SB 5044, which is about teacher training and not curriculum, although I totally agree with the point just made, has nothing to do with critical race theory. In my view, the recent controversy over CRT is completely fabricated, a false issue that's meant to be divisive. And lastly, that the district remains committed to, quote, teaching a complete and accurate history that is inclusive and without bias. These are common sense positions, and to the extent that the resolution affirms them, I could support that resolution. My concerns are, as has been mentioned, about why this resolution is being brought at all. Parts of the resolution seem intended to mollify the misguided view that teaching diversity and inclusion, or teaching about the history of racial injustice in the United States, is divisive. I'm thinking specifically of the language that says no student, teacher, or staff member, quote, should be taught they are an oppressor or victim based on their race. Let me be clear. Of course, no student should be taught that they are an oppressor or a victim simply because of their race. And I'm quite confident that we can trust our teachers, especially with adequate diversity and inclusion training, to teach issues of racial injustice in our society without suggesting any such thing. But we must acknowledge it is impossible to teach an accurate history of America without teaching about the social structures of racial injustice and inequality in our past and our present. The system of slavery that existed from 1620 to 1865, the system of Jim Crow segregation that lasted for 90 years after the end of Reconstruction up until the major civil rights acts of the 1960s during my lifetime. And sadly, those structures of inequality didn't just vanish in 1968. To this day, we have stubborn structures of racial inequality in terms of economics, education, our criminal justice system, and voting rights. The fact that we have such stubborn patterns of racial injustice in our society doesn't mean that all white people are oppressors. Of course not. But it does mean that we have real problems in our society. And our students need and deserve to learn about these problems. In a democracy, public schools should be able to teach the truth about the nation's history, including our shortcomings. For these reasons, I urge the board to take very seriously the resolution's commitment to, quote, teaching a complete and accurate history that is inclusive and without bias, and to support our teachers and students in meeting this important goal. Thank you.
Molly Monahan Krishman.
I'd like to be put to the end if I could, and just listen. I think that my comments are going to be changed a little bit, just given some of the...
Okay. Jessica Kowalski, or Kowalski.
I'll try to be brief. I didn't prepare anything as eloquent as the many people ahead of me, but I can join in with some of the people ahead of me and state that I am a district graduate. I'm the daughter of a district teacher. I have children in the district and in fact used to be employed by the district. So I have a very long history with this district, and I'd like to be able to say that I'm surprised that a school board in this district took such a ridiculous act, but I'm not. And I just want to remind people that CRT is just a lens. Much like a microscope exposes things that aren't visible to the naked eye, CRT is just a lens through which we can examine different things in our history that aren't looked at typically, much like humanism is a different way to look at different things that have happened throughout history in a different way. There's lots of different ways to look at things that have happened. This is just one of those lenses. And Jim just gave a brief history of it, but I also had a note that just saying that 72% of our nation's history has occurred under slavery or Jim Crow, and this resolution wants to ignore 72%. And that's just outrageous, and it's not preparing our kids for the future and going into corporations or being teachers. I wish I was more eloquent like these people, but I'm just sitting here absolutely astounded. I agree that this was not a great process. What is the point of all of us speaking if you've already made up your minds? It's ridiculous. I'd like to say I'm surprised, but ultimately I'm just not. I'm just continually disappointed. Frankly, it's why I separated from the district.
Next up, Jill Neumeister.
Hello. My name's Jill Neumeister. I have lived here for some time. I speak to you as a mom. My son graduated from Peninsula High School. He is now a medical doctor. He received an amazing education from the brilliant teachers at this school. I also speak to you as a Native American. I was at that meeting and heard the basket comment. And I'm a Pawnee citizen, a proud Pawnee citizen. I'm a descendant of the Choctaw Nation. I'm a second generation urban native. I've lived in this community for a long time. I'm disappointed that I didn't hear a land acknowledgement at the beginning of this meeting. And I'd like to take the time to acknowledge that I am a guest here. We are a guest here on the native and traditional lands of the Puyallup people. Now, I am just stunned. I can't believe that this was voted on without comment. DEI, diversity, equity, inclusion. These are honest words, words that mean something positive, something real. The term critical race theory. There is not one school in this state that's teaching CRT. What these folks are really trying to do is control public school curriculum. They're trying to dumb down the voting public. They're just taking all the bigoted grievances, such as the teaching of Black history, massacres,
Thank you.
Indigenous history, genocide, Asian American history, internment camps, LGBT rights, into one lump and calling it bad. Bad CRT.
Thank you, Jill.
I have news for you.
You fake CRT flag wavers, it won't work.
Thank you, Jill. Next up is Ben Laramie. If I pronounce that wrong, I apologize. Pass, okay. Carol Rivera.
First, before I start, I just wanted to welcome Superintendent Barr at our first official school board meeting. I wanted to start my comments tonight by referencing Article 9, Section 1 of the Washington State Constitution. It is the paramount duty of the state to make ample provision for the education of all children residing within its borders, without distinction or preference, account of race, color, caste, or sex. Educators, families, citizens, administrators, and elected officials, we all partnered together for our children, not just to meet a constitutional obligation, but to reaffirm a shared commitment to public education through the landmark McCleary decision. In 2018, Peninsula School District Board of Directors, along with Superintendent, created our own shared vision of what that looks like locally. It's called the Peninsula Promise, and it states, "We as a Peninsula community make a collective promise to our children to empower every child to discover and develop a passion for learning and achieve a fulfilling and productive life. In our schools, every student is cared for and respected. All students are exceptional in their own ways and will develop through the widest range of educational options. All students will be confident, passionate, lifelong learners, prepared for success in life, having experienced success in our schools. We believe that our children are unique and diverse, learn at high levels, thrive in an environment of caring and connectedness, possess a sense of wonder and curiosity. Our staff are uniquely talented to meet the needs of every child, serve with compassion, advance student excellence and attainment, learn and grow professionally. Our schools provide a variety of supports to serve the whole child, every part of them. Model collaborative environments, have a clear and shared focus, innovate by creating new and better opportunities. Our district ensures a variety of programs and options for students and staff. We hold high expectations with the highest levels of support, demonstrate leadership and vision and courage. Our community partners with our schools to provide a broad opportunity for learning, supporting students and staff, celebrating the success of our children. That promise also comes with an action plan and 5 goals developed by the superintendent with the full knowledge of the school board. It's number 1, to optimize learning and teaching preschool through 12th grade through rigorous engagement and culturally responsive opportunities which reflect the whole child. We ensure effective, high-performing staff across all aspects, employ innovative and effective resource management, student learning, engage stakeholders in that process, and provide a physically and emotionally safe and secure learning environment for students and staff. We all have a shared responsibility to create and foster an inclusive and acceptable, accessible public education system that puts students on a trajectory for the future, filled with opportunity and success. This is the promise Peninsula School District made, and it should remain our shared purpose in our schools. Thank you.
Next up is Melody Derrick.
Thank you, School Board, for allowing us an opportunity to speak. I'm kind of embarrassed that even though my daughter is going to graduate next year, I haven't been to any school board meetings before tonight. I work full-time. I've worked in commercial construction for 25 years. I've driven to Seattle almost every single day, so you know how that goes. I would say that I have reviewed the legislation on SB 5044. I support this resolution. I'm not sure I support the resolution from the school district, but I do support the legislation. Justice, equality, diversity, and inclusion are values that I think everybody could get behind. I know even in my industry, which is still extremely largely white, male dominated, I have been the only woman in the room and the only woman in the trailer for a very long time. But I will tell you that we conduct diversity training all of the time. I have worked at large multinational corporations, I've worked at small companies, and it is absolutely part of what makes us successful. We cannot work with clients, we cannot work on projects, we cannot work with private clients or public clients without understanding these principles and without having a diverse workforce. So I would say that even as a parent, I think these are great ideas, and of course, as a worker and a member of the corporate community, I can tell you, I can second the gentleman who came up here earlier. These are values and programs that need to be taught, and they will, your students are going to run into them. It doesn't matter where you work or what's going on. So I would also like to say, as a person who has a history degree, I think that it's important to recognize that history is always changing and we're always learning new things. This is important. It's important to teach to our kids that our knowledge of history is always expanding, like our knowledge of science. So, you know, there's been recent news stories about historical events in Tulsa, the indigenous residential school graves, the graves in Ireland, and even the history of the Confederacy and the Confederate statues. These might be difficult and challenging ideas to talk about, but I can tell you as the parent of a teenager, difficult and challenging is what happens when you talk. So those are things that we need to do to talk about, and I think that our students and our teachers are going to be well served by learning some techniques and some respectful debate and dialogue inside the classroom. Thank you.
Next up is Grace Derricks. Did I already say? Grace Derricks.
Good evening, everyone. My name is Grace Derrick. I am a student at Peninsula High School. I will be a senior next year. I'm deeply involved with theater. I'm deeply involved with drama. And I'm also an AP student. I am an advanced placement student. Last year, I took AP United States History during one of the most difficult school years I think I've ever experienced. We learned about continuity and change over time, I think, in regards to historical themes, such as tumultuous changes in economic growth and expansion, foreign policy, isolationism. We learned about the American Revolution, the Civil War. We learned about federalism, anti-federalism. But one key thing was missing from our education, and that was critical race theory. Now, while critical race theory is not currently taught in our schools, it is a critical part of our education that we recognize this. We must recognize that Black people are oppressed in this society and that there is a systemic racism that runs deep in our country. I'm fully aware that this Proposition 5044, is not a bill to enact curriculum of critical race theory into our schools, and it is rather simply a teaching program. Now, I like to consider myself pretty tight with a lot of my teachers, frankly. I think we get along well. I know that I trust my teachers. I trust my teachers to teach me what I need to learn. I trust them to learn from me as well. I trust them to learn from the higher ups. I trust them to learn justice, equality, diversity, and inclusion, and effectively enact that into our school district. I, as a student, am personally offended that one would propose that critical race theory would be taught to someone who is under the age of, say, like 12, maybe even a little older than that, maybe even 15. I'm personally offended that these teachers are being demonized for teaching something that needs to be taught. I'm personally offended that these teachers are not given trust by the school board, by anyone, to teach what they need to teach. This bill proposed today, this bill will allow us to, of course, have this teacher training. However, I am deeply saddened that critical race theory is not a part of it. And while I do recognize the bill did only include this teacher training, I'm deeply saddened that it has to come up today at this meeting. I'm deeply saddened that it is a partisan issue. I would like to remind all of you that I am your future. I am your future. In over a year, a little over a year, I will be a taxpayer. I will be a working citizen. I will be a voter. And I need my education. I need my education. I need my educators to be trusted. That is all. That is all. Thank you.
Next up is Karen Anderson.
I'm not sure this is going to stay up for me.
You just hold it.
Just hold it? Okay. All right.
There you go.
Apparently so. All right. I'm here to speak today as someone who taught history for 40 years. And so I've had all kinds of students, and I've taught a wide range of classes. I even, in fact, taught critical race theory at the university level, which is where, of course, it's usually taught. One of the things that concerns me about the resolution today is that critical race theory was banned without being defined. So it can, as we've seen, it can mean many things to different people, and I think that's part of the hazard. But what I'm here to say today is that, one, I appreciate that you've said that it is appropriate and acceptable for history to be taught fully and accurately. I think that that's key. One of the knocks on critical race theory by those who haven't read it is that it asks white people to feel guilty about what happened in the past. It does not. I don't recall ever reading that anywhere. What it asks instead is that we look at the past, and what we owe it is an honest telling. That we tell it as completely and as diversely as possible. I once had a class where I assigned students to read 4 documents about a set of conflicts over race in a community. Each document said a different thing about it and came from a different person with a different relationship to the conflicts. Then they had to write a 1-page paper saying what happened. Well, imagine the confusion that ensued. But basically, they did a pretty good job with it. They looked at why would this person see it this way and that person see it that way, except for one poor guy who just came in. He did turn in a paper. It wasn't, frankly, very good. But he said, I don't know what to believe after I read this. Why can't you just tell me what to think? And I said, I can't follow you through life doing that. So you're going to have to learn how to do it for yourself. And I think that's the benefit of seeing history through many lenses. That if we just see Thomas Jefferson through one lens, we don't see the whole picture. if we just see Abraham Lincoln the same way or anyone else, if we look at our villains as only villains and our heroes as only heroes, we deny them their full human complexity. We deny them their flawed humanness. And I will give you one example. Orville Faubus was the governor of Arkansas when Little Rock blew up because black students were entering Central High School. At any rate, what you need to know about Faubus is that he was absolutely not a racist before this conflict. If anything, he was an egalitarian. But he was faced with his political career or his principles. He chose his career. So I think that asking us to put people in their context and seeing that actually Faubus did some good things along the way asks us to think differently about who's a hero and who's a villain. But it doesn't ask us to abandon whatever moral principles we might bring to the inquiry and to believe that any teacher can teach without moral principles is to be deluded. The best you can ask is that they know what they are and that they ground their teaching in an honest acknowledgement of that. Thank you.
Next up is Sarah Garriott.
I'll glue it. Can we glue it? Do you have any super glue? All right. Good evening. My name is Sarah Garriott, and welcome, Superintendent Barr. We've been looking forward to your arrival, so we're glad that you're here this evening. Thank you. I am actually really thrilled to be here this evening because I have never seen this many people at a board meeting before, and I wish that we could do this more often, frankly, and it wouldn't be such a formal occasion because I have loved hearing all of your diverse voices. I have loved hearing our different opinions instead of seeing names on a social media thing that I don't know who they are, and it has given me a bit of your humanity, and I hope that you can feel mine. Because all of us here come with very different ideas and futures, but we are all human, and we are part of this community. And I want you to know that I love you for your passion and that you would show up, because it shows that each of us care for our children, and we prioritize them above everything else, and we each want what's best for them. And so, while I don't always agree, I wish that we could get together and see each other face to face and discuss these things more in person, passionately and with deep emotion, and respect each other's humanity. With that said, I must say I was disappointed tonight in the sex ed curriculum resolution because we had been working so hard. And I think, for example, the 2-week notice before sex ed is taught, I was disappointed to hear that that wasn't on the resolution. Why are we trying? We're not trying to cancel sex ed. I had a foster mother. Where did that come from? I had a foster mother who came to me and said, I have a sexually traumatized child. Sometimes my children come to me during the school year. And if they've announced that they're going to teach sex ed at the beginning of the year, and then they have it randomly, and I missed that appointment, my child ends up in that class. I didn't get the notice, and now this child has to deal with that trauma over again. So some of these reasons that we're trying to restrict sex ed to sex ed and not have it integrated into other subjects come from a deep place of common humanity. It's not because we're against sex ed or that we're prudes, but because we also care so deeply about these children. And this is something that I really hope that you will reconsider, that we don't integrate into these other classes, because these children need to have this protection for a true opt-out. They need to have a safe place. They need to be able to know that they can go to school and that sex ed will stay in sex ed, and the parents, especially these kids who have this sexual trauma, will know that that is safe for them. We hope that you will reconsider. We're really a little bit disappointed. We worked so hard to get that petition, all 610 signatures, 23,653 people who voted in the majority in this district to reject comprehensive sex ed methodology being mandated from the state. Not that we didn't want sex ed. Of course, that was never what the vote was about. It was never about whether we were going to teach abuse or not. That wasn't what it was about. It was about whether or not the state would be able to mandate a methodology upon which each curriculum would have to be based, and not be able to keep that within local control. So please, I hope you'll reconsider, that we can talk some more. Thank you very much.
Pamela Weiss. Pamela Weiss. Okay. Father Seraphim.
Okay. So I'm Father Seraphim. I am 5 kids at the district, 2 graduated, lived here a long time. So actually, there's a lot of things, it didn't go quite the flow of things that I was expecting. So I actually have a slightly different tack that I was going to offer. So if I can use my time however I like, what I'd like to do is just take 15 seconds and just be silent and ask everybody to just get in their heart and be at, just find a little bit of peace. I'm not here in any opinion. I'm just here because I'm a community member and I see a threat to peace in the community, and I just want peace. And I want everyone to be able to function in a way. So I think a lot of emotions, and you guys are taking so much. Welcome to Gig Harbor, Superintendent. And I want to affirm that you guys are stepping into a role that you don't have to, and you're the target of stuff, and you're also celebrated for stuff depending on whose opinion's being expressed right now. But I just want to thank you guys for stepping up. Whether I'm agreeing with you or not is not the issue. So I just want to take 15 seconds to just be quiet and to just get down into the heart, and we'll be heart-centered people for a minute. Thank you. So I had different topics, but basically some people have said, hey, Father Seraphim, you're a person of color. You're not super jazzed about critical race theory in different forms, which I'm not. But I don't want to present myself as a person of color who's against CRT, because I don't want to buy into the mentality that backs that, which is there's different groups. My whole thing is yeah, I'm a person of color, and I'm in a mixed marriage, and I have kids who are of mixed racial background. But for me, the point would be to look past those and take an honest look. And as an educator, I was an educator for a long time and have an MED. I taught in public schools in Santa Cruz, California. And as a priest in public schools, one of the things that I really tried hard to do was keep the circle tight around basic education, as the attorney had said, and never introduce my own personal viewpoints into my classroom. So I'm a priest. I mean, obviously I have a view of the world, but I worked really, really hard. So I wanted to just affirm that part for you, to ask you to continue to back that up, to leave ideology to everybody that has a different one, and just focus on the public part and let everybody sort it all out in a spirit of peace and in the public methodology that we have, so everyone can get along even though we disagree. And that's what I'm hoping, that everyone will be cool.
Bridget Majumar. Yep.
Significantly shorter than my dad over there. Good evening, my name is Bridget Majmadar. I am that guy's kid. I graduated from Gig Harbor High School in 2016. I had an absolutely wonderful experience. I was at Goodman Middle School from 7th grade up. I was a child of color, sort of. I was half and half, which is even potentially a more odd place to be as a child. I came in to Goodman Middle School as a 7th grader, and I was a little browner than most of the people around me. And I'm here to tell you that I graduated in 2016 from Gig Harbor High School, having had 6 years of unbelievably fantastic teachers, most of whom I probably would politically disagree with. I had a huge circle of wonderfully inclusive friends. I knew administrators, I knew attorneys in the area. I had so much community engagement, and not one person ever made me feel less than for the color of my skin, ever. But to boot, I was also given a very, very well-rounded education. I came from a objectively pretty blue area and ended up going to Hillsdale College, where I graduated in 2020, a pretty well-known conservative school. And I got the whole spectrum. And I've never once regretted that. In fact, I am unbelievably thankful that I got to walk into the halls of Hillsdale College, one of the 2 schools in the nation to have a commencement my year. I was able to walk into the schools of Hillsdale College with a well-rounded education from Gig Harbor High School. I was able to walk in there with conservative parents and liberal friends and show up to college and think my own thoughts and be respected for thinking my own thoughts. And that was made possible by advanced curriculum at Gig Harbor High School. I was an AP student as well as an honors student. And I was able to think critically about the conservative ideas that I was getting from Hillsdale College. And I was able to look back and think critically about the ideas that I got from Gig Harbor High School. I learned about critical race theory at Gig Harbor High School. I learned it. In fact, I debated with it. I immersed myself in it to such a degree that I could literally argue with people about it and win trophies. Right? It was taught to me, not because somebody mandated that it was taught to me, but because I was in a sport. That was a way that I could see the world. And I thought, okay, I have a good enough basis from the people around me, from my parents and from my teachers, that I can embrace an idea, look at an idea, and yet still emerge my own critical thinker. I think we run the danger here of distrusting our teachers, but almost more importantly, distrusting our students with what they can handle and what they cannot. If we have an absolute basis of critical thinking, teaching critical thinking, teaching how to read an advertisement, teaching how to read an essay, teaching how to check a source, if we have those baseline teachings from an early age to a late one, it's really, really hard to go wrong. So I encourage the board to stick with those principles as best we can and move forward with a lot of positivity in the district. Thank you all.
Molly.
Hi, everyone. Good evening. A lot of the principals and teachers in the district and a lot of the kids know me as Dr. Molly. I use she, her pronouns. And I do training across the country for parents and educators who want to do better talking about race and racism with the kids they love but aren't sure where to start. I join many folks in the room in my disappointment that we voted on something tonight without dialogue, and that there are components of this decision tonight that seem to me to be ill-informed. This idea about teaching our kids that they are oppressors or oppressed, that's not part of critical race theory. I learned about critical race theory as a doctoral student. By the way, I have a master's and a PhD in educational administration. And I have taught at the university level about social justice. And when I had kids of my own, I thought, how do I do this thing that I do pretty well with college students? How do I do this with my own kids? And I didn't know how. So I started learning. That was probably 13 years ago or so. When we got here to Gig Harbor, I was a bright-eyed and bushy-tailed parent who wanted to be very involved in the district, and I became the room parent at my child's kindergarten room. Now, she didn't really know neither one of us knew what we were getting into, but one of the things that she first asked me to do was to plan a party where we dressed the children as pilgrims and Indians. And I was not going to participate in that. And she had a real problem with that. She said, the parents love it. I am a scholar of history. This is accurate, and we are doing it. this led to me joining the district diversity, equity, and inclusion team because I think that maybe my principal needed for me to have a different outlet than her. And now I am super involved in this amazing community and engaged in diversity, equity, and inclusion with the district. I co-chair with Joy our Gig Harbor for Racial Justice group. I do trainings right here in our district and across the country. And I'm just here to say that critical race theory, it's a good thing, y'all. If you hate racism, you are gonna love critical race theory because it helps you notice, name, and dismantle racism. And I want us to be able to do that as parents and educators and to teach our kids how to do that too. So I hope that this is not the end of the road for this conversation because there are some pieces of this resolution tonight that need to be tweaked, need to be shifted if we are really going to teach our kids everything they need to be successful in college and career and even right now with each other in the classroom. Thanks so much.
Thank you. One more. Okay. Next up, we'll have Section 8, District Reports. We have a report from the Chief Financial Officer, Karen Anderson.
Good evening. This is the exciting part. Tonight, we are prepping to adopt budgets. We will be adopting budgets in August. But tonight we're going to bring you the other funds. So we have 5 funds total in the district. The largest being the general fund, which is our day-to-day operations. But tonight we're going to bring you the other fund budgets, which are the capital projects fund, the debt service fund, the associated student body fund, and the transportation vehicle fund. And these are, and so proceed. Where did I point? Okay. So we're going to start with the Capital Projects Fund. Our Capital Projects Fund, our major revenue sources are, see, I empty the room every time. Thank you. I know. It's boring stuff. I get it. So revenue sources that come into this fund are our capital bond proceeds, state match funds, and impact fees. Those are the largest pieces that are coming into this fund. And our expenditure projects for current are our 2 new elementaries, Pioneer and Swiftwater, our new in lieu elementaries, Evergreen and Artendale, and our modernization middle school projects for Key Peninsula and Kopachuk. So when we adopt a budget, we're adopting, the board is adopting the expenditure capacity that we're projecting for next year. As we look at the budget and we develop the budget, we have to do a couple of things. We have to look at where we're at in the current year and what we think is going to actually happen based on our estimated actuals, and we develop what we think is going to be our estimated ending balance, which gives us our estimated beginning balance for next year's budget. So we believe we're going to start the budget with $54 million in fund balance. We're going to add to that $37.6 million of revenues. The revenues are made up of impact fees, and we're going to start getting our state matching funds from our projects, And so that will equate to about 37 million, a little over. Our expenditures for next year, we anticipate $91 million, a little over. And that is expenditures that will support the projects that were currently in existence. Currently, we're closing out Pioneer Elementary. So there's still some expenditures that, we have to, do our closeout checkout lists. And then all of our other projects that I mentioned will be active and so we want to build enough contingency or capacity so we can support those projects throughout next school year or fiscal year. So we're estimating an ending fund balance of a little over $1 million. Of that, we have to identify the revenue sources and what's left in fund balance. We believe that we will have spent all of the bond proceeds. We will have a little bit of state matching funds left over. We will have some impact fees, both Pierce County impact fees and city impact fees. And then the remaining balance of about $1 million, which is unassigned. The next fund that we have is the debt service fund. And this is where we make our payments for principal and interest on our outstanding bonds. So this fund, basically currently, our outstanding debt, we have two issues. We have the bond issues that we sold in 2019, May of 2019, and we have the bond issue that we sold in May of 2020. And the bond proceeds come into the Capital Projects Fund, and that's how we pay for our expenditures for the capital projects. And then this fund, we levy taxes based on what we need to pay for debt service payments. We levy taxes on a calendar year basis, and then we develop our budget for what we're going to make our principal and interest payments on. So the taxes that are coming in will be about $12 million, a little over 12. Our expenditures, so our debt service payments, will be a little over $12 million. And that will leave us with $4.9 million in fund balance. Keep in mind that we are on a fiscal year, so it's a combination of two calendar year levies. So we get the fall collection in the fiscal year, we get the fall collection of the 2021 levy, and then we get the spring collection for the 2022 calendar year. So that's how our revenues come in. The next fund that we're going to talk about is the Associated Student Body Fund. This is for all of our student bodies that have student run government activities. That is basically everything about students. The majority of the activity in this fund is mainly our secondary schools. We do have a couple of, we have, I believe, 4 elementaries that participate, but most of our elementaries, if they have any funding that comes through, they run it through the general fund, through their 08 account. So, but as you can see, if you look at the current year column for estimated actuals, there wasn't a lot of activity, either in revenue or in expenditures, compared to what we've done in typical in the past. And the reason why is because of the year that we had. But our student bodies were very enthusiastic. They found ways to operate. They found ways to come together as an organization, and they each were able to adopt a budget for next year. High hopes that everything is going to be very similar to what has happened in the previous years, and that we won't be faced with a lot of cancellations or not being able to run Tide Fest or Winterfest. So the budgets for next year are very, very typical of what's happened in previous years. So, yes. Oh, you know what? That's my error. It should say 2021, 22. Yes, yes, yes. Sorry. That's mine. I'll fix that. Gosh, good catch. Good catch. No, I forgot to change the title. So the numbers are changed, but yeah, but the header is wrong. So I apologize for that. So as you can see, if you compare the two budgets, they're very, very similar. One of the things that we did this year is we built in a little bit more budget capacity because we really wanted to make sure that we are adopting an expenditure budget that will support whatever activities need to happen for the students. And we know that from last year, we know that there are some new clubs that are starting. There are some new, we have the Global Virtual Academy starting. And so what we wanted to do is those students haven't had the opportunity to create a budget, but if they want to do something in the next year, we wanted to have the capacity so that they could create their own budget along the way and be able to do things. So that's why we added a little bit, but it's very similar to previous budgets. The last fund is the Transportation Vehicle Fund. Currently we have 63 large buses and 39 small buses in our fleet. They are all up to date. And we have a current, all of our buses that are on the front line are all on depreciation. So for next year's budget, we're estimating that we're going to start with about $845,000. Keep in mind that our apportionment or our depreciation funding that we get for this fund, we get it at the end of the fiscal year. So we get it on August 31st. So whatever we spend what we received in the prior year, and we won't get anything more until August 31st of the next year. So something is happening this year. We have 12 large buses that are going to go off depreciation. So way back in 2007, we received a federal matching grant, and we were able to purchase 4 large buses, and the district match was that we had to buy another 4. So the federal government supplied 4 buses for us. We matched 4 buses, so that brought us up to 8 buses. At the same time, there was a delay in the 2007 engine, the new engine that was coming out. And so what happened is that the previous year's purchase of buses was delayed. And so we had 4 more buses that were coming in, and they all came in the same year. So they all went on the depreciation schedule at the same time, and they're all coming off at the same time. So if you look at the revenue, what we're anticipating for this year, the $700,000, and you compare it to next year, we're really only anticipating about $500,000 in depreciation. The difference between that is, excuse me, we have a bus that was, I'm having a brain fade. We have a bus that went off, it was totaled. So what happened is our insurance is going to pay us for that, and we will be replacing that. So typically, we only purchase 3 large and 3 small in a given year. Next year, we're going to purchase 4 large buses, and we're anticipating that we'll get insurance to help cover that 4th bus. What we're going to have to look at in the future is, because our depreciation is lower, we may have to consider whether or not we want to use some of our levy funding to support continuing to buy 3 large buses and 3 small buses over time until we can catch up. We can keep the 12 that are coming off depreciation. They're still in good shape. There are spare buses, and so we can keep doing that. We have upped in previous years. We were only purchasing 2 large and 2 small, and we did increase that several years ago so that we were kind of anticipating that we would be okay. So we're not really losing, we're just being a little challenged as far as our revenue coming into that fund. So in the future, we may be looking at possibly creating a transfer between general fund and this fund just to help support the purchase of buses, because they're not getting any cheaper.
The buses? So, because you just said they're not getting any cheaper, I wonder, what is the capacity of a small bus, and do we ever consider something like a 10-passenger van that might be more efficient, cost efficient and fuel efficient, and would suit the needs of different programs who use those buses?
We've looked at it. I think a lot of it is we have several small buses, and where we can, we do use them for, we're using them for the smaller ECAP students. Before we weren't we were putting ECAP students on big buses.
Mm-hmm.
But if we can, we're using the small buses for ECAP. So that does help smaller groupings, smaller routes. And we're using it for, individuals. If we go in between, the challenge is the routes. Some of our routes are longer, some of them are shorter, and it doesn't really help us. So we basically just said we're going to get either the large or we're going to have the small.
Okay. And then as far as the new buses, do we know if they have green technology coming online for school buses?
So we're looking into some grants. What we have heard is that there are some grants coming down again from the federal government, but there are some, school districts are starting to look at newer type propane, different clean air buses. And so we are looking into some of those options. I don't know if it's cost prohibitive, if it's equal, then, and then we also have to look at what kind of maintenance do we have to have on those, what kind of tanks do we have to have for fuel, those types of things. So we'll be looking into that. Yeah.
Can you also get a government lease and just take out a lease to the bank and then pay it back like a traditional lease? Interest
We
rate's
can.
pretty low.
We can lease buses. It's very similar. We're up against the same thing. You only get so much from your depreciation schedule, and so we would have to look into that too. Every year the state does a bid process for multiple groupings of buses, and so what we try to do is we try to put our order in for our next year's buses. We try to put them in at the beginning of June, because at the end of June they update the bid for buses. So we try to get in the prior bid so that we're trying to maximize what we can, what we don't have to pay. So that's kind of helped us a little bit too. But we're looking at all options because we are starting, until we can get our revenue back up because of the depreciation. 4 of those buses that are, the 4 that were purchased with federal funds, when we go to surplus them, we have to actually destroy them. I know you've asked in the past, when we surplus, items, what can we do with them? Our buses usually go to auction, And there have been some that have gone down to Mexico and Guatemala. But there's also some that they go to the fire districts for, exercises and, those types of things. But the 4 that are federally funded, they will have to actually be destroyed. So we won't be able to sell those.
Okay.
Any other questions? So the only other thing is, at the August 12th study session, we're going to bring to you the general fund budget. This is pretty complex this year. We've got ESSER funding that we need to incorporate. So we'll have a lot of discussion. We'll have some different approaches as to our logic as far as how we're using the ESSER funding, and just kind of the routine stuff. We also have to talk about our forecasts, so what we're forecasting for each of our funds for the next 3 years out. So our adoption process will happen on the 26th board meeting. We need to have a public hearing. We'll do the adoption resolution. Again, you're adopting the expenditure budgets for each fund. We'll again show you the forecasts for all the other funds for the next 3 years. And then we'll also have you approve our levy spending plan for 21-22. So.
Karen, is there going to be opportunity for this to go before the Finance and Audit Committee prior to coming to us? Is there?
Sure.
Okay.
Sure.
Thank you.
I can set up a meeting. Yeah.
Thank you.
Thank you.
Okay.
And then I just wanted to say one more thing. I apologize. It was my oversight, and you had it all right, and everything else. My apologies. It was a perfect report. Thank you.
No,
Me
I
being
missed that
lazy.
one.
Sorry about that.
Thanks, Karen.
Uh-huh.
We don't have any old business or new business. It's just a item 10.1 is first reading of policy 3520, student fines, fees, and charges. And then there's no discussion around that, I don't believe, right, Kristen? And then first reading also for 10.2, revised policy 3231, student records, as well as 10.3, revised policy 5200, drug-free workplace. This just stems around the fact that the district periodically gets new guidance on our policies, and we just have to go in and update them based on new guidance, sometimes from the state, sometimes depending, but like everyone, you just have to update policies. So we will do the second reading and approve the policies at the next board meeting. So up next is item number 11, our new superintendent, first superintendent report.
All right, well, I don't know how long this is, but I'm going to talk a little while. Is that all right? Not too long, I promise. You can stop me in 3 minutes. First of all, I just want to thank the remaining audience here. Thank you so much for staying. Good job. You have staying power. But on a serious note, I just want to thank the many people that commented. What I heard as a new person coming into a school district and an educational leader for over 37 years is I heard a real commitment to and appreciation of the excellence of the academic program, but also of the whole child in Peninsula School District. So before I actually start reading, I just want to say this is really a special place. And recognizing that and being able to work through complicated situations is what public education, that's what we do, right? And we do that well on behalf of children. So I want to thank the educators that spoke today and how impassioned they were, and the civility in which you all shared information. I want to thank our Peninsula School District staff right now. You know, we say that it's summer, but we have meals that are being given out every single day in order to look at meal insecurity and just sometimes just a connection. We have bus drivers, we have buses coming to classrooms. We have our summer SOAR and recovery. We have the Boys and Girls Club partnership and the communities in schools, and I haven't met them yet, so I'm very excited about meeting them. We have our PIA high school and extended school and summer learning opportunities and we have West Sound. These are many programs I have not seen, and I look forward to doing that. Hope and promise of Peninsula children for excellent public education. I heard tonight we experienced a passion for this community to create and invest in lifelong learners and critical problem solvers. And this is our opportunity to make that impact. So thinking about the pandemic, I mean, I never thought in a million years when I was in school that we would be having conversations about mask or no mask, right? Or social distancing and all of the things the last year and a half has really brought us. But thinking about an opportunity, what has been lost? What have we gained? And what remains? What needs to be built back better? And we heard themes of that. Are we all doing all that we can for our children to be successful? Those are questions that I come in with fresh eyes, hopefully, but a lot of experience and a heart ready to problem solve. Each one of us is teachers and advocates for children, and we saw examples of that. We are at the heart of the success of reopening schools and reimagining schools for the future. We have to navigate this time that is so challenging. So thank you for being here. The struggle to implement vision at a time that we have so many constraints requires us to work together. Our opportunity is so great right now, and it's resting on all of us how we can all make a difference. So that's how I come to you. I had to write it down because I didn't want to forget anything. Last week, I had an opportunity I serve on the AASA. I'm one of 4 elected officials. We're all superintendents, and we go to the nation, and we actually went to the Holocaust Museum and to have an opportunity to speak. So there are themes that weren't even mentioned tonight, themes that we will be looking at this year is local flexibility. We heard a little bit of that, but local flexibility in funding. How do we resolve the homework gap? We saw that in terms of hotspots and connectivity. Medicaid reimbursement, IDEA full funding for special education. Currently, we are getting closer to 48%, but we still are not fully funded. Increased funding for Title, how will that be used? There are promises of free lunch and breakfast for food insecurity beyond this year, beyond the pandemic. Mental health support around anxiety and depression, healthy schools, pandemic support and beyond. We don't want to start something now and not be able to continue and sustain that. How do we safely bring students back into school, which we heard, and universal preschool, which is a rural focus. So in Peninsula School District, educating the whole child is our moral imperative, which includes things such as SEL, the arts, wellness, STEM, and et.cetera, with a focus on having all students feel like they belonged. I just want to thank those students for coming up and the passion that they communicated and the love that I heard that they have for their instructors, their teachers, their guides, their coaches. That cannot be, let's not forget that. Let's put a pin in that and say that is a strength. Our students need to feel that they have access and opportunity, and where there is greater need, there must be more support. Partnerships matter. Through intentional wraparound supports, or in many cases, our students that need to accelerate, a focus on college readiness and CTE opportunities. We heard from business people that it is the soft skills that matter. In partnership with the board, I'm honored to be a part of this school district and the 5+1, that's what we are, 5+1, and staff and families. Now, a return to in-person learning is a need to lean in and learn from this pandemic, which means that I commit to you this evening, my first meeting. There were a lot of people here. I thought you all came to see me. So, but I will listen. I will listen, and I will listen to concerns. I'm not going to assume I know anything. I'm not going to assume I understand why. I'm going to listen. So tonight, and I don't know if it's already published, but I have a 100-day plan. I'm already, I think, 20 days in it, 15 days in it. And And that's the only way I know how to go forward. The 100-day plan kind of spells out that if there's an opportunity that you wish to contact Tanya and make a time, I would love to come out. But just know this, I'm not going to come out and lecture at you. I'm really there to listen and partner. I have been a superintendent 8 years prior to coming here, and it has been my intentional move out here. So I am here to stay as long as you will have me. Ample time and ability to learn together, that's what I'm hoping for. In person or remote, learning families. Okay, and that's really it. I just want to say thank you so much, and thank you, board, for sponsoring a robust conversation and for inviting me to join your team. So I look forward to a really great year, lots of planning and lots of learning. So thank you. It won't always be this long, I promise.
Oh, sure, you're gonna start with me. There was one of the presenters that talked about seeing things from different perspective. One of the classes I took years ago was how to see things from each other's. We called it, you can't see my side of the coffee cup. And so if I was holding up a coffee cup, you don't know what's on my side. And it could say 2 words on one side and something totally different. I think the resolutions that we did tonight were read in a different way than what we intended them by many of those people. Those resolutions that we approved tonight went back and forth between us. They were not a blanket statement that was handed to us. They were modified, and when I read those statements, the resolutions, there's a lot of good things in there, good things recognizing the great things that the school district does. Somebody mentioned that they couldn't teach certain things, and in no way. The one statement says that no student, teacher, or support staff shall be taught that they are an oppressor or a victim. That's the only thing it says that they can't be taught. I think there was a lot of misunderstandings. I think there were a lot of emotions that people read into these resolutions that weren't there. These resolutions, I think, were just a statement that we put out to try to clarify a lot of misinformation that was out there. And I think people saw this in a different way than it was meant to be. And I'm done. That's it. That's my statement.
So, I did it.
Yeah, okay.
We, as a board, had the opportunity to meet 5+1 yesterday. It was open meeting. We were just there. Really had a great opportunity to talk more with Superintendent Barr and really, as a board, talk about values. And all of us at the table really shared a lot of the same values that Carol, you brought up in the Peninsula Promise. They're all there. We are all embodied in those values, and will continue to as we develop a strategic plan and vision and mission for our district in the future. So it was a fantastic conversation. I'm thrilled to be working with this board for the next 5 months and what, as a district, as a community, that we will deliver. Very excited on that. In terms of 5044, the resolution that was passed tonight, it as well embodies what Carol Rivera shared earlier. It is about empowering every child. It is about having a unique and diverse community and create wonder and curiosity. That is something that is very, again, very near and dear to this board. I stated this at the last meeting. I am thrilled about the training that I'll receive under 5044, because what I think it does for me, it really helps me be more informed and understanding that every child comes to the table with a different story, a different set of needs. And we have to develop practices, policies, priorities that will address all of these different needs of these kids to help them be successful individually. So that resolution to me is about the training that I'm going to receive as a board member, and I'm thrilled. So that's all I have to say.
I also just want to add my welcome to Superintendent Barr. It's just a real pleasure to finally be working together after, meeting you back in the spring, and I appreciated the day we had yesterday to plan and to vision and to, like Deb said, to talk about our values. And I'm just going to make my comments short and sweet. I really very much appreciated every speaker tonight. Starting with, I really appreciated having the attorney here answering questions. I think that mask issue is very confusing, very complex, as we learned, and things aren't always as they seem. And so that was awesome. So, but just wanted to say I appreciated very much every single speaker. I took notes during that, but what I wrote down was, to me, the most significant thing that each person said, and the viewpoints were, or the most interesting thing, or something that I maybe didn't understand, because I think that it was incredible to hear a well-rounded bunch of speakers and different viewpoints on the same issue. And so there's things that I want to learn more about, and things that I just really, really appreciated, and especially the student speakers and the educators. It's so great to see really the results of what goes on in the Peninsula School District. And we're here, of course, for our kids and our students. That's why we do what we do. But we have fantastic educators, and we do value them and trust them to do what they do and do it with excellence. And that's what we're about in the PSD. So to that end, I had one more comment. It was just that, if I didn't make this clear already, yes, there were some things, I think, sort of as Chuck said, some speakers shared opinions of the resolutions that I found not to be at all what was my understanding of what we discussed as a board. And so I have work to do to follow. I want to follow up with those persons to find out where is this not what I thought it was. So, because some of the viewpoints were surprising to me in a way that I think can be easily resolved with a follow-up. So anyway, thank you again to everyone for attending.
Okay, also welcome Creston for sitting through your first meeting. This was a good one, because we had a lot of community input. And I mean that seriously, a good one, because I think our community is strong because of the people who come and speak so passionately about our students. Also, in reference to one of the resolutions regarding Senate Bill 5044, I will echo what I think some others have said, in that I don't know if we all agree on what that means. Some of the language in that was crafted very carefully, and I appreciate that some have picked up on our intentional words to say we will continue to teach an inclusive education that includes all stories and all perspectives. And to that end, I realize sometimes we sit up here and we get to hear from you, and you don't always know who we are. We are part of this community, the same as you, parents who are willing to stand up here and speak on behalf of our citizens and represent ourselves and represent our community. But you don't always know our story, and looking at us, you might not always know that. And to share just a moment of my personal story, I am a daughter of immigrants. My father was not just an immigrant, but a refugee. And he came to this country speaking 4 languages. One of them was not English. And this was in the mid-50s. And living in New Jersey as a young man who didn't speak English, he did not experience inclusion and equity. And I feel that passion because my family has experienced it. And sorry, just a second, take a breath. The thought that we would do something to our kids to make them feel excluded or unheard or unimportant, or our families to feel unvalued, is truthfully the exact opposite of the intent of this resolution. We want to clear the noise because we know that our teachers do it best, and we know that you have the best interest of our students at mind. And the politics will go away, and you will continue to do your jobs, and we will continue to support you in that. And we will continue to support our children. Thank you.
Thank you. I think, as you said, those resolutions were all approved and worked on by the board. They were thoughtfully drafted. They went through several revisions, and what we brought forward we thought was in the best interest of the kids. And and I'm proud of the work that the board and the superintendent did on those resolutions. I wanted to just reiterate the fact that we went to the celebration of life for Caleb a couple weeks ago, and how wonderful that was. Just reaffirms how wonderful our community is and the support that we have whenever a member of our community and one of our families hurting. So it was an honor to be there to help celebrate Caleb's life. As some said, we had a retreat yesterday. One of the things as a new board that we want to work on is a new strategic plan. The current plan that we have now is about 7 years old, and it's time to get changed. Some of the things that we were working on now were sort of dropped on the school board. They really weren't designed by us. They were given to us, and this will be something that we work on together as a vision of where we want to see the school district go, based off of the values of all 5 plus the 1, and it will be a document that we hope will be primarily for what's best for our students. Students first is sort of our mantra, what's best for our kids. And so I look forward to working with the board over the next year to develop our strategic plan. Hopefully, maybe it takes a little longer to do it right. We'll involve the right stakeholders in developing that plan. But it's something that's needed in this school district as we look to the future on where we want to go. I think we have a wonderful board. We, as I said many times before, we don't always agree on everything, but we ask thoughtful questions, challenging questions, and at the end of the day, treating each other with respect. In the end, we do what we believe is best for the kids. And that's how I get up every day in this job, in a volunteer job. And it's been a tough year for all of us to take heat from both sides. And but I know my responsibility is to do what's best for the kids, and that's why I get up and do this job every day. And so I look forward to working with, I believe is going to be an amazing superintendent in Creston Barr. And that's all I really have. And I will adjourn the meeting at 9:04.